Okay, there we go. Can you hear me now?
Yes.
Okay. So I just want to thank everybody for joining us today for our special board meeting. And we indeed are excited about selecting our new CEO for the exchange. And I really cannot say how grateful I am. So very, very grateful for all of the board members that are able to attend today. We so appreciate your time and what it means to spend this day with us for this very important task so that the exchange can continue as it has been doing to grow and be better than ever under the best leadership possible. So before we actually start, of course, we'll start with roll call and a few housekeeping items, tips for the virtual meeting presented by Tiffany. Thank you, Tiffany.
Good morning. Thank you, Madam Chair. Tiffany Davis, Executive Assistant with the Silver State Health Insurance Exchange, for the record. Just a couple of housekeeping reminders. I just wanted to let everyone know that Caitlin Blagan and Katie Charlson are both hosting this webinar meeting today. So as a reminder, please keep yourself muted if you are not the one presenting or making a comment. For those who are on the phone, please remember to continue to mute yourselves, or else we'll be able to hear your private conversations. And then also for anyone speaking, please remember to state your name for the record before making a comment or presenting. This helps us with our transcripts later on. And I'm happy to move on into the roll call, Madam Chair. And so doing so, Dr. Jameson.
Present.
Valerie Clark.
Present.
Elsie Lavon Lewis.
Present.
Dr. Sarah Freeman.
Present.
Jonathan Johnson. I saw he joined us. I thought I'd give him just a minute to connect. Jonathan Johnson. Okay, maybe not this time. Oh, just one moment, Madam Chair, if you don't mind, with the roll call. I just received an email from Jonathan. He said he's having trouble connecting to the Zoom meeting, but he'll join as soon as he can. So we'll mark him as present. Jose Melendrez, I believe, is absent. Quincy Branch.
Present.
Thank you. Stacy Weeks. Go ahead and unmute yourself.
Sorry, I was having issues. I'm here.
Thank you for that confirmation. And Commissioner Scott Kipper.
Here.
Thank you. And Teresa Bowden. I believe she's absent. Excellent. So, Madam Chair, we do have a quorum for today's meeting.
Absolutely wonderful. And I would like to go ahead and start with the public comment, which Tiffany will oversee now. Before opening to the public comment, clear and complete instructions on how public comment will be made as usual by Tiffany.
Thank you again, Madam Chair. Tiffany Davis again for the record. For public comment, with this last legislative session, AB 219 that was passed, there was one piece that now requires that clear and complete instructions for a member of the public to make public comment during a virtual meeting must be verbally read prior to the comment period. So I'm going to do that now. We'd like to remind those that are online or who have called in that if you would like to make a public comment, please raise your electronic hand or indicate in the chat box if you would like to make a comment. And Caitlin, or you'll actually be unmuting yourself once Caitlin calls on you. For those who are on the phone lines, you will when we get to calling on you, you'll go ahead and unmute yourself and then make your public comment at that time. So to start with, I would like to go ahead and start with our conference room in the Carson City office. Alex, is there anyone in our Carson City location? Do we have anybody in the physical location who would like to make a public comment at this time?
Alexandria Zanini for the record. Yes, there's a few here in the Carson City office that would like to make public comment.
Good morning, Madam Chair and the board. Shay Starbuck, Quality Assurance Manager here at the Exchange for the record. I would like to start off by introducing myself. Like I said, my name is Shay Starbuck, and I'm the Quality Assurance Manager here at the Exchange. I have been with the Silver State Health Insurance Exchange since September of 2019. And with my time at the Exchange and the experience in working with two of the candidates being interviewed today, I would like to show my support in favor of Russell Cook as our new Executive Director. In Russell's current role as our security officer, Russell has had the opportunity to learn and provide assistance when needed in every department in our agency. Additionally, Russell has been a key player in our success to function as an agency when there has not been an executive director in place. Russell's ability to learn system functionality and make decisions that are in the best interest of Nevada HealthLink is what this agency needs to move forward as a successful state-based exchange. In closing, I would like to leave you with this. If Russell Cook is chosen for executive director, I know that Russell will continue to lead our agency in a positive direction, continue to build positive rapport and good working relationships with carriers, vendors, and other stakeholders. And most importantly, make decisions with Nevadans in mind and continuing with our mission to keep Nevadans, to get and keep Nevadans insured. I believe that Russell possesses key qualities and with that will make a great executive director. Thank you so much for your time and allowing me to come on for the record and express my support. Your decision today has an impact here at the Exchange and is greatly appreciated that you have allowed me to provide my feedback. Thank you so much.
Hello, everyone. My name is Brooke Mills, for the record. I am the Health Data and Resource Analyst here at the Silver State Health Insurance Exchange. I would like to take this opportunity to provide public comment to share expanded details regarding my preference for the new Executive Director appointment. During my 7 years of state service, I have never had the pleasure to work with anyone more committed to doing what was right than Russell Cook. It is an unfortunate truth that many choose to do what is expected, to repeat what has been done historically, or to strive for the most minimal of expectations without questioning if it is truly the best that can be done. Stepping into the role of the Exchange's data analyst, I was confronted with the results of such practices regularly. There was no one more willing to examine the status quo and to completely uproot procedures to improve the quality of the results than Russell. I am certain that his integrity, ingenuity, awareness, and ability to embrace collaborative critical thinking makes him the ideal candidate for the overwhelming task of leading such an essential and dynamic agency, not only for the incredible staff at the Exchange, but for the residents of the state of Nevada who depend on the services of Nevada HealthLink. Thank you for your time.
And Alex, do we have anybody else there in the Carson City location that would like to make a public comment?
No, there was not, Tiffany.
Okay, concluding with our Carson City location, physical location, I'll ask online. If any of the attendees would like to provide public comment online, you can raise your electronic hand feature on Zoom if you have that capability. And Caitlin will call on you when you do, and then you can unmute yourself. Caitlin, do you see any hands raised for public comment?
Hi, Caitlin Blagan for the record. No, I do not see any hands raised at this time.
Okay, and do you see any in the chat? Any public comments? If anybody has put any messages in the chat for public comment?
No, there is nothing in the chat.
Okay, thank you for that confirmation. And then I'll go to our phone lines. If there's anybody who's called in, I was unable to use the virtual hand for public comment. If you would like to go ahead and unmute yourself at this time to make your public comment, you may do so. Again, if you are calling in on our phone line.
This is Caitlin Blagan for the record. We do not have anybody on the phone line.
Perfect. Thank you for that confirmation. Madam Chair, I believe that concludes our public comments at this time.
Thank you for the public comment. We appreciate the input, and we'll consider that as the board members will be listening to these candidates and then making our selections at the end. Interviews will be started immediately since we do have 3 candidates, and we're
Madam
going to have. Yes.
My apologies for interrupting, Madam Chair. We do need to have the board approve of the last June 22nd board meeting.
Yes. Thank you so much for reminding me of that. So yeah, let's go ahead and I would like to entertain a motion from one of our board members to pass our recent board minutes, and they are indeed posted on our exchange. Can I hear a motion?
Valerie Clark, move to approve.
And do we have a second?
Quincy Branch, second.
Lamont Lewis, second.
And everyone in favor of, well, is there any discussion on the minutes?
Madam Chair, I would just like to say that there was one comment about the health plan, Friday health plan, that they didn't know who made the comment, and that was my comment, just for the record.
Oh, thank you so much. Okay, and other than that, there has been no nothing else for additions, no corrections. Okay, hearing nothing else, then everyone in favor of passing the minutes from June 22nd, 2023 board meeting, please say aye.
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 Aye. Anyone opposed? Okay, anyone abstained? Hearing no one opposed or abstained, the minutes are approved unanimously. And now we shall start the interview of candidates for the Silver State Exchange Executive Director. We have decided to list them in reverse alphabetical order according to their last names. We will be starting with Jennifer Krupp, then Troy Johns, and finally Russell Cook. And before we start, Tiffany, did you have any other comments about our interview?
I do. Thank you, Madam Chair. Again, Tiffany Davis for the record. I would like to just go briefly over the kind of outline of how the process will go today. Of course, a few of the, some of the outline is, of course, at the board's discretion how they would like to handle a few things, but here are DERM's recommendations. And then if there's, I'd like to see if there's any questions before the board jumps into the interviews. So at the end, I would like to say that at the end of the June 22nd board meeting, the voting members of the Exchange Board had chosen 4 applicants to move forward in the interview process. And since that time, I did receive communication from R.C. Pope that upon further consideration, that she would withdraw her application from this interview process. She expressed her gratitude for the opportunity of being considered for the Exchange Executive Director position. So thus currently, as you said, Madam Chair, we will have 3 applicants for the board to review. The 3 candidates are currently being held in their own waiting rooms, unable to hear the meeting or each other. And we'll bring each of the candidates in one at a time for the interview process and return them to the waiting room once the interview is complete. Please wait for me or Katie or Caitlin to confirm that they are in the waiting room after the interview before any discussion begins with the board. And then once a decision is made, we will bring the candidate back in for the board to make the offer to them for that position. I would like to say that for the 3 candidates who will be interviewed, again, in reverse alphabetical order, we do have Jennifer Krupp from Richmond, Virginia. We have Troy Johns from Las Vegas, Nevada. And then thirdly, we have Russell Cook from Carson City area. So again, as Madam Chair said, you will be interviewing Jennifer Krupp first. To help with facilitating these interviews, if anything comes up, if the board has any questions, we do have with us today Monique Williamson from Agency HR Services, and then of course our DAG, Michael Dittmer. So if any questions come up, please don't hesitate to ask for their expertise and their advice. Today with us, we do have 6 voting members and 2 ex officio members. And although the ex officio members do not have a vote in the final decision, they will be participating by asking a few of the questions and by assisting the voting members with advice and expertise. All the references for the candidates have been checked, and we have received feedback for each candidate interview today. There was no unfavorable responses from any of the references for any candidate. The board will be asking 15 questions total, 12 questions and 3 interactive follow-up questions. Each interview will be about 45 minutes to go through the first 12, and we were thinking about 15 to go through those last 3 and any maybe follow-up questions that the board would like to ask. We do ask that the board take careful notes during each of the interviews, as the board will discuss the candidates after all 3 interviews have concluded. And I will alert, I don't mean to be rude, but I will alert the board when we've reached that 30-minute mark in the interview for each applicant, just to be able to kind of keep us on time with everything. So if I pop my hand up or if I kind of jump in there, that's why. After all the 3 candidates have concluded the interviews, then the board will have discussion, make a motion, and vote on who they would like. They will also be taking into consideration, again, ex officio's feedback, staff feedback at that time, and just so that it's clear who, when we do the votes for transparency, we'll do the voting by roll call when the time comes. Just again, so people on the phone lines know how the board is voting for those who aren't able to visually see what's going on in the meeting. And so at this time, I'd like to ask and then finally, when the chosen candidate will then be brought back into the main meeting room. And upon their acceptance of the position, myself, HR, will work out the details and paperwork for their transition and any terms and conditions that need to be worked out afterwards. So at this time, I just want to make sure, did all of the board members receive the interview questions that I sent out this morning around 8:15? Everybody received those? Okay, wonderful, great. And then does any board members, do any of you guys have any questions about the process before we jump into the interviews? All right. Seeing none, that's great. Madam Chair, we can go ahead and start with our first interview if you guys are ready, and we can bring Jennifer Krupp in if you all are ready.
Thank you so much. And yes, so we will be starting at approximately 10:19 by the time we get going. And please go ahead and bring Jennifer in.
Actually, one more thing, sorry, before we bring her in, I just remembered, I wanted to say that all the questions that we have, there's 12 of the 12 questions, 6 board members were chosen to ask the questions, and the same board members will be asking the exact same questions to each candidate, again, for fairness and consistency. So with that being clear and said, Caitlin, do you want to go ahead and bring Jennifer into the room?
Caitlin, for the record, Jennifer, you should be in the room now.
Good morning, this is Jennifer. I'm waiting for my video to get started. Oh, good morning. Do you guys see me okay and hear me?
Yes, good morning, Jennifer. It is a pleasure to have you join us this morning, and we so appreciate you applying for this position. And we have all received your information, your bio CV references, and we have a format set up that will be similar for interviewing each candidate. And we will have some of our board members and ex officio members ask questions, and for each candidate that will be repeated so that there is fairness and everything is on par. So we would like to start with our Dr. Friedman with the first 2 questions. Dr. Friedman.
Thank you, Madam Chair. The first question is, what are 2 or 3 professional principles that would guide your conduct as an executive director?
Thank you so much for the question. And I did also want to start by saying thank you to the entire board and to the staff at the Silver State Health Insurance Exchange for having me here today for the interview. I do sincerely appreciate everybody's time. 2 or 3 professional principles that I would use to, to guide the role of the executive director.
Guide your conduct as an executive
Guide
director.
my conduct, right. As the executive director, I would say first and foremost, transparency. And I would say transparency because I think it's very important to be very clear with everybody about what your operations and what your thoughts are, how you're making policy decisions, and how those decisions would impact the consumers that you serve, the staff, the other stakeholders that we have to take into consideration. And then the second attribute that, or the professional principle would be integrity. I very much have a very strong, deep and core belief that integrity is very, very, it's just one of my core values. It is very important to me that I say that I do what I'm going to say that I'm going to do, and that, I operate in a way that is ethically sound. And then, so transparency, integrity, and then finally, I would say that the third one would be service, and ensuring that, the exchange and that in my professional conduct that we are always putting the service of the consumers that we serve at the forefront of everything that we do. And that service encompasses not just our consumers, but again, our stakeholders, our staff, our team, and overall the state of Nevada.
Okay, thank you. The second question is to please describe your leadership style and provide specific examples of how you can envision your leadership style being effective in changing organizational culture, building successful teams, and resolving serious or long-standing conflicts.
Okay, so organizational culture, building long-standing teams.
Changing organizational culture, building successful teams, and resolving serious or long-standing conflicts.
I thank you for your patience. I do want to make sure that I'm addressing each point of your question. So in terms of my leadership style, I've always led through mostly a servant-based leadership style. And I've always held the core belief that my team and that the entire team is only as strong as, the person that is, struggling the most. And so as a leader, I've always taken the approach of making sure that my team has the resources that they need to be able to be successful. So in specific circumstances that I can point to that would demonstrate that is being available for my team members, making sure that I am available to help answer questions. I've always had an open door policy, taking the time to meet with my team members to help them understand, what our goals and objectives are, and, really clarifying what their role is in helping the entire organization as well as the team achieve those roles and objectives. I also place a very high emphasis on ensuring that I am providing adequate training opportunities to my team members and to the organizational staff. So some specific examples would be particularly at my time with DPBH, making sure that my team had access to additional trainings and certifications. One thing that I'm very proud of is that I mentored 3 people to become Lean Six Sigma Black Belts, which was actually a pretty significant achievement. We had to do a project and have that project approved to get that accreditation. And I take a very strong approach with mentoring and making sure that I'm helping mentor my staff and advocate for my team to make sure that they are getting the things that they need. And a big part of that is really listening to what the needs of my team members are. And some of that is, making sure that I'm open to understanding, not just what is working well for them, but what things aren't working well for them, and finding how I can help resolve those things that may not be working. And sometimes that may be helping them find solutions to what problems or circumstances they're experiencing or roadblocks that they can't move through. And then, building successful teams as well. A really core tenet of my leadership style has always been recognizing that, you know, not only are we a team and not only are we here to do a job and provide a service, you know, in this case for the citizens of Nevada, but also recognizing the individuality of each member of my team and recognizing the importance of things like work-life balance, recognizing recognizing like the importance of things like work-life balance, recognizing how important it is that people will oftentimes have circumstances and situations that may be happening in their lives outside of work that is going to be impacting, you know, how they're showing up at work, and being understanding and respectful of that, and just really taking more of a holistic, whole person approach to my leadership, and not just having expectations of, you know, constant productivity or constant grind, but just seeing that, you know, we're all people, we're all living lives, and that we all are here to do really great work. And the way that we can support that great work is making sure that people are feeling, you know, safe and secure in their positions, and that they have the resources that they need to do their jobs. And that, as I ramble on, but
Oh,
you know,
that, Dr. Friedman, was there a portion, she may not have heard the last part of your question.
Yeah, is it getting
oh, no, I'm still going.
resolving serious or long-standing conflicts?
Yeah, I hadn't gotten to that part yet. I'm sorry. I was still going on the building successful teams part. And so part of that building successful teams is making sure that everybody feels, you know, recognized, included, that work-life balance is important, and that, you know, that we understand that everybody is going to be respected as individuals as well as members of the team. And that also goes into building your organizational culture as well. So, you know, building successful teams is also one of the strategies that I've used quite frequently here when I was at the Silver State Health Insurance Exchange, also my most recent position in Virginia, was really encouraging people to work together. So I do, you know, one of the things about working in health insurance exchanges, and sometimes people haven't worked in exchanges, sometimes they have a difficult time seeing this, but everything is so interconnected, and it's really important that you rely on your team members to help move projects and move things forward. So for instance, I would say like a really good example of that is understanding, you know, how perhaps like the quality assurance team, understanding the complaints that are coming in from our consumers and being able to trace those back to, say, a specific policy decision that the exchange may need to make. So in situations like that, if we had a high number of complaints that were coming in, or a high number of issues that were coming in from consumers in one specific one specific area or one specific topic, it would be encouraging those, you know, the quality assurance team members to take that to our policy team to see, you know, do we need a change in policy to address this? And then, you know, if it is determined that maybe a change in policy would be needed, then, you know, how do we implement that policy? How do we push that policy training back out to the quality assurance team? It can be long-winded. Thank you so much for your patience. And so just really encouraging a lot of collaboration and cross-functional work. I'm a big supporter and proponent of cross-training as well. I certainly want to make sure that everybody has a strong enough understanding of what other people and what other departments within the exchange do, so that there is a full functional understanding of what is happening. So I do think that is a very important part of building successful teams. And then finally, working to address long-standing conflict. Was that the question?
Yes.
So, yeah. So when it comes to addressing issues of long-standing conflict, you know, really, I think clear communication is going to be very important. And in instances where I have worked to resolve long-standing conflicts on teams or in organizations, I found that it's really very important to get to what the root of that long-standing conflict or disagreement may be, and bring all parties to the table to be able to determine really where the issue is, and then work with those parties to start developing a path to move forward. To give an example of a longstanding conflict that I had worked on, at DPBH when I was population health systems manager, we had a conflict with an employee who, we were experiencing high levels of absenteeism, high levels of, her coming late to work or leaving early and not necessarily performing as well as she could have. And really working with that employee to understand, where the basis of her disengagement was coming from, and realizing that she wasn't feeling, valued as a team member. She was getting inconsistent guidance from other members of the team. And so we worked with her to really sort of clarify her role, and set some parameters and boundaries around the work that she was doing that also enabled her to have a great deal of more control over her role and her position, and gave her a lot more autonomy in what she was doing. And it really helped her become a lot more confident, and it resulted in her being significantly more engaged in her job. And she went on to continue promoting up and staying with the organization. So that is one example of resolving longstanding conflict, but really just getting all the parties to the table, communicating, really understanding what the root of the conflict is, and working together to move forward to resolve that conflict.
Thank you.
And it was probably a rather multiple part question, and it very complicated. So thank you.
Thank you. And please, if there's something that I didn't address well enough, or if you'd like me to expand on, please don't hesitate to stop me. I don't want to ramble, but I have a tendency to do so in job interviews because I have so much that I want to say, and I know it's a limited amount of time, but I definitely want to make sure that I'm clearly answering everybody's questions.
Yes, thank you. I think all of the components are covered for me. I'm happy to go on to the next question.
Yes, thank you, Dr. Friedman. And now Stacy Weeks will be asking the next question 3 and 4.
Good morning. Hi. So number 3, this job involves immense pressure from stakeholders, which includes insurance agents, brokers, carriers, state lawmakers, consumers, small businesses, just to name a few. How would you balance these competing forces in your job as executive director?
So it's a little complex to be able to say how I would balance those competing forces without having, exactly a specific scenario to point to. However, I think one of the things that is most important to recognize is that each of these stakeholders are crucially important for the success of the exchange, and all of their voices are extremely valuable, and they are extremely important to the success of the exchange. So given on an issue by issue basis, there are times where you're going to have to find compromises. I think one of the things that is important as an executive director to recognize and remember is that oftentimes there isn't any one right answer, and there's oftentimes not one answer that is going to fully satisfy every stakeholder. However, it's important to get everybody's feedback and really understand what is most important to each of these individual stakeholders, and do your best to meet what their needs and goals are. I would say, I'm just trying to think of like a specific scenario. I would say, like, perhaps with during my time at the state-based at the Nevada Exchange, when the pandemic first hit, and making that decision in 2020 whether or not we were going to implement an exceptional circumstances special enrollment period so that we could, open up this SEP to consumers who hadn't applied for coverage during the open enrollment period in 2020. We knew that that was going to be something that was very crucial to help Nevada citizens obtain coverage in the light of the COVID-19 pandemic. But there, were concerns from, carriers that this was essentially going to open up a second open enrollment period and that that could have an impact on the rating, the insurance rating that had been done for 2020. And so working with all of the various stakeholders to implement a special enrollment period, an exceptional circumstances special enrollment period that was open to those people who hadn't previously applied during the open enrollment period was the solution that we did that I do think was a very good way to balance the needs of the various stakeholders. It did allow us to, we enrolled, I want to say the numbers are escaping me right now, but 2,000 additional consumers who didn't previously have coverage, but it was also in accordance with the rating that had previously been done. And it was a solution that across the broad spectrum of stakeholders, people seem to be most comfortable with. I'm a little distracted by your Boston there. I have two myself, so. Does that answer your question fully?
Yes, it does. Thank you. So what would you say the biggest challenges facing state-based exchanges in terms of achieving their goals and mission as outlined in the Affordable Care Act? So basically, what is the biggest challenge right now facing state-based exchanges like Nevada's? There's a second question. Do you want me to start with that and then finish with the last one? Would that be easier?
It might be, yeah.
Okay, yeah.
I would say right now the biggest challenges that are facing state-based exchanges nationwide are just, the number of changes that are coming out of CMS. We've got the continuous coverage unwinding happening with the end of the public health emergency and really ensuring that there's continuous coverage for those populations that are coming off of Medicaid, but then coming onto exchange coverage and making sure that we're able to effectively capture those people that are transitioning. It's a significant amount of marketing and information and outreach that needs to happen and has been happening to these affected populations to ensure that they know, what they need to do, what is expected, return your renewal packets, make sure you're filling them out, make sure you've got your correct address on file, and where people can go to get help. From a state-based exchange perspective, it is making sure that we are, really focusing on ways to make coverage accessible, making sure that people do have the resources and the assistance they need to sign up for coverage. It's also making sure that our efforts are, equitable and that we are really working to identify populations that, may be disproportionately impacted by some of the policy changes or some of the policies that have happened and working to mitigate some of those disparities. And just over the last couple of years, just the frequency of changes and the speed with which state-based exchanges, and I'm particularly proud of how Nevada has handled quite a few of these changes to be able to respond quickly because they really have resulted in more people obtaining coverage and maintaining that coverage. I think that's another really key and critical factor is it's really, step one is getting people covered, but step two is really keeping people covered and making sure that they're maintaining that coverage, over the course of the plan year and renewing their coverage year over year.
So the second part of that question is how would you help address these challenges in Nevada, considering its unique coverage environment as executive director?
So really, I think a lot of the work that Nevada is doing is moving really well in that direction of addressing some of these unique coverage conditions. I think continuing to have a strong relationship with the Division of Insurance and with our carriers to ensuring that we're offering, adequate coverage options statewide, that there's, more than one option for a carrier in each of our rating areas, I think is going to be really, really important. Again, I think that really continuing to have robust marketing and outreach efforts is going to be really key. Really focusing on reaching consumers where they are. And what I mean by that is, making the information for Nevada Health Link really accessible, and making sure that it is easily found in places where people are going to be looking for health insurance information. So some of the really great work that has happened in Nevada would be, some of like the outreach, like making sure that, continuing to ensure that our navigators are, going to these multicultural events throughout the year, working with the partnerships with our schools, working with the partnerships with the DETR, the Department of Employment Training and Rehabilitation, to ensure that people who may be getting laid off from their work are getting information on Nevada Health Link, doing a lot of the, continuing to do a lot of the rapid responses for organizations that are going to be experiencing layoffs. So there's that. There's again too a lot of a lot of things that can be done at the policy level to really make sure that consumers are able to have like adequate choice with insurance coverage. Am I answering your question well enough? For
Yes, thank you.
You're welcome.
Thank you so much, Stacy. And we will be going on now to Jonathan Johnson, board member. Now, he was having trouble. Has he been able to get on?
I'm here.
Oh, there you are. Welcome. And he'll be asking questions 5 and 6.
Yeah, thanks, Jennifer, for joining us today. I've got a feeling this next one will be a little bit of a layup for you, but as you know, the exchange is responsible to the state of Nevada for proper fiscal management. Please take a moment to describe any legislative or fiscal experience you have had, and that's going to include working with budgets, etc. Moreover, please explain your familiarity with the state of Nevada's legislative process for submitting budgets.
Yeah. I've handled our budget basically end to end through the development process all the way through the budget submittal. So a really key component to budget development, especially with the Silver State Health Insurance Exchange, is really having to project out almost up to a period of 5 years, any and all scenarios that could happen, and being able to build your budget strategically around any of those levers that may occur from a policy standpoint, from an enrollment standpoint. So for instance, if your rates go down but your enrollment goes up, what is that going to mean to your revenue? Because it's not a direct relationship, it really is kind of more of an inverse relationship, as well as being able to predict out what your expenditures might be, and that can come in the form of system changes that need to occur, increases or decreases in call center staffing. As far as I know, we haven't decreased call center staffing, but certainly having to plan for unanticipated increases. Again, policy changes. The pandemic was really an unexpected event that had happened shortly after we had transitioned, and so being able to successfully budget and be able to provide for the changes that we needed to make through that experience. It's really important looking at your staffing needs, whether or not you're going to need additional staff, and looking at what your community, what your partners, what your navigator entities, your brokers, what their needs are going to be, what they're going to be, and making sure that you, and your carriers, and making sure that you have plans to be able to adequately budget for any changes that may be necessary. And then conversely, it's one of my core principles too is like just really good financial stewardship. You know, I've always been very, very cognizant that the funding that, or the revenue that Nevada Health Plan takes in really is, you know, it's paid for by the consumer. So making sure that we are really strong stewards of those funds and making sure that they are used in a way to really benefit the state overall has always been very important to me, and definitely one of my core tenets and values. So I would say one of the ways that, you know, we had been able to do that during my time with the Nevada Exchange is looking at the Navigator program and changing their reimbursement structure so that they were able to achieve further and greater reimbursements, and therefore like more fully execute our Navigator funding and keep more navigators on staff, which was really important during the pandemic to make sure that we had, you know, people who were able to help our consumers when they needed it the most. So, does that fully answer it? You know, I'm like go into like the specifics of like it's a biennial budget process. You got to budget out for 2 years. You know, you have to do decision units and determine what changes you're going to need year over year, but you really have to think about it over 2 years. And sometimes, you know, things slip through and you have to go to IFC or interim finance committee. But
So you're familiar with the process.
Very.
Jonathan, real quick, sorry to interrupt. I don't mean to jump in there, but I just wanted to give you a heads up that we have 2 minutes before our 30-minute mark of the 45-minute interview for the 12 questions, and we have about 6 questions go. So I just wanted to give everybody a heads up on that.
Well, we'll keep rolling. Thank you.
Right. I tend to be verbose in these circumstances, so I'll try and streamline my responses.
That's all right. So next question, what public speaking or engagement experience do you have? Examples responding to media inquiries, any public relations experience? How have you handled potential negative or difficult questions from statewide or national media?
Yeah, absolutely. So in terms of public speaking experience, it really representing the exchange during my time. Anytime we were going for the budget committees, the board of examiners, doing our budget presentations to the legislature, you know, working, presenting to the, you know, the Economic Development Bureau. I don't know if that is actually the right name of it, but you know, making presentations to other state agencies and entities regarding the exchange, particularly as it related to our budget and you know, our contracts. Prior to that, at the Division of Public and Behavioral Health, doing public speaking to smaller groups, but really, you know, with stakeholders, subrecipients, doing a lot of large group trainings. When I was heart disease and stroke coordinator, speaking publicly to the Heart Disease and Stroke Task Force, which was comprised of 64 different members. So lots of public speaking experience. I will say I'm a little more poised when I'm not in a job interview. This does have a tendency to make me nervous because the focus is solely on me. Also, I'd point to my experience not only on the Nevada State Board of Nursing, an extensive amount of public speaking there, but also as a board member on the Public Employees Benefits Board, public speaking experience there. In terms of media inquiries, most of my experience would come from the Silver State Health Insurance Exchange, where oftentimes I was responsible for formulating some of the data points that would be publicly reported. You know, I would be responsible for developing any responses that we had that were in relation to budget questions, contract questions, enrollment metrics. At least I believe that has changed, but at least our enrollment metrics as we had transitioned through the exchange. And then from a public relations standpoint, really speaking extensively with the governor's finance office, the Legislative Counsel Bureau, not so much directly with the media, but as part of the executive leadership team at the Silver State Health Insurance Exchange, working together to formulate what our responses to media inquiries would be, as well as to, you know, for instance, like the Legislative Counsel Bureau, when they would have questions that would come over. But over the course of my entire career, I've always had to be very cognizant of external communications. And I think probably the biggest or the most important thing, at least from my perspective, would be, ensuring that messaging is consistent and that we're anticipating questions that stakeholders, legislators, the media may ask, and understanding very clearly, really what their interests are and working to anticipate that. So for instance, if you're preparing a response to a legislator, you want to understand really kind of like what their core issues and, what things are important to them, because that's going to shape the questions that they're going to ask you. And I will also say, like in my most recent position with the Virginia Health Benefit Exchange, there was a lot of work with our broker community in formulating a lot of the responses related to that. There had been some questions about whether or not the Virginia Exchange was going to adopt, some certain broker functionality versus other broker functionality. And so working with that team to sort of formulate our responses and our strategic direction related to that. So quite a bit, I would say.
Perfect. Thank you.
Thank you.
Valerie? I think it's over to you.
Righty. I wasn't sure if,
Valerie, yes,
Okay.
question 78. Thank you so much.
all right. Hi, Jennifer. I'm Valerie Clark. Next question is, how would you rate the importance of transparency in the executive director role? And what methods would you use to promote transparency throughout the organization?
So I think that transparency is really, it's really important for all stakeholders, but I think that we do need to be like mindful of, what information really we need to be transparent about, and what information is maybe not as important, because you don't want to detract from, your key messaging or your key mission. So I do think that transparency is highly important. And then the second part of the question was, how would I
How would you promote, or what methods would you use to promote transparency throughout the organization?
Yeah, absolutely. So I think that internally it's really important, like I had said earlier, that, we all have the information that we need, and that we're all, putting out the same information internally from the organization as externally. We want to make sure that all of our messaging, again, is consistent. One of the things that I found through the course of my career is that if there are questions that are important to people, but they have gone unanswered, people will make up they'll make up a response. They'll make up what they think is going on. And so I think being really cognizant and aware of that, and making sure that we understand what questions are being asked and why those questions are important to our stakeholders in our community, so that we can make sure that we're getting them the information that they need, so that we have the ability to manage our messaging in a way that fulfills, everybody's needs. But I do think that it's very important, and I do certainly subscribe to this belief myself, that, you need to keep, your stakeholders fed. And I do think that, transparency is a key tenet of that. And for me, even personally, understanding why an organization is doing something and what those impacts are going to be is extremely important to the success of that organization. So does that fully answer your question?
Thank you. Next question is, please describe your philosophy and approach when making big decisions that will affect your organization.
My philosophy and approach to making big decisions that will affect my organization. First and foremost, I do try to consider every angle. I do have a tendency to think of every possible outcome that could happen and sort of go through, it's almost like a risk analysis log that I, just kind of do, but just thinking of like all of the possible outcomes that could happen, and then making sure that I understand, for my own professional judgment, which ones I think are going to be best for the organization, but then also making sure that I'm getting input and feedback in from, my team, other critical stakeholders or members, to make sure that I'm considering all of the angles possible, because I certainly recognize that, as a leader, there are many inputs that need to go into that, and you can't possibly know everything. And there have been many times throughout my career where I thought one course of action would be the best, and then have gotten additional information or new information and realized that my thought process or my course wasn't necessarily the best, or that there was information that I hadn't previously considered. So it made me change what I thought our best course of action would be. So it's really going through the process of analyzing it myself, and then seeking feedback from those who would be impacted in what their thought processes and concerns are, but really working to ensure that it's essentially a collaborative process. I mean, I think that's very important, to make sure that you are taking in all sides, and not operating in a vacuum.
Thank you. I appreciate that.
As Tiffany pointed out, I believe we still have 4 questions left, and we would love to hear your key points on each of those questions, but I believe we're down to about, for the first 5 minutes.
7 minutes, Dr. Jameson.
7 minutes. So we have 4 questions in 7 minutes. And Scott Kipper, will you go on with questions 9 and 10?
Thanks, Dr. Jameson, and good morning, Jennifer.
Good morning.
The Exchange implemented a new eligibility and enrollment system, and thus this position works very closely with the contracted technology vendor, Get Insured. How do you see your role in managing the Exchange's vendors, and what would be your approach to problem escalation?
Yeah, absolutely. So I worked very closely with our vendors when I was already when I was the chief financial officer at the Exchange. So in the executive director role, it is not as hands-on day-to-day as I would say that my role had been previously, but I would still think that it is very important to be working with your vendor regularly, having regular check-ins, working with your staff to make sure that you have regular check-ins. Really, one of the key things that I had done a lot of as the CFO was working with our vendor to negotiate change requests and building business requirements. And so my role as executive director would still be highly involved in those areas. However, I would see mostly my role transitioning to one where I am less involved with the day-to-day, more involved with the larger, long-term, bigger scale types of projects, and making sure that we are accomplishing our KPIs, our metrics, making sure that our consumers are being well serviced. And then in terms of escalations, that is a bit of a difficult one to sort of ascertain, because I would certainly see like the larger, bigger issues would be moved up to me for problem resolution. But I will say, this is such a high functioning team that oftentimes that wasn't always, there wasn't very many instances where it felt like we needed to escalate things all the way up to the executive director level. Is that answering your question well?
Sure.
I'm trying to get through from a time perspective. I will say one of the things that I've always done with our vendors is really working with them to make sure that everybody's needs were met, particularly the exchanges, but it's also, being firm and making sure that our vendors understood what our needs were, and making sure that they were delivering their deliverables on time and in accordance with the contract and in accordance with the change requests that we had agreed upon. So I do tend to be a bit of a stickler in those areas.
Thank you.
Okay.
The second question is, what is your specific experience in the field of individual health insurance? And also describe your working knowledge of insurance rating principles and processes.
Yeah, absolutely. So, working in the individual market, most of my experience comes from actually working at the Silver State Health Insurance Exchange. Also, as a board member, I was appointed by Governor Sisolak to the Public Employees Benefits Board. So in that capacity, voting and making recommendations on plan benefit design, what our rates were going to be for state of Nevada employees and other entities that were covered through Public Employees Benefits Board. So, looking at claims data, making projections about how, claims were going to change, over the course of, the next upcoming year to 2 years to 3 years, getting that information from the actuaries and then, looking at what those recommendations would be in terms of where they thought the rates needed to be set. And then, voting on where we thought that we could, comfortably meet our obligations to Nevada employees. And then, really, at my time with Medicaid and my time with health management systems, that was a little bit more like claims driven, but it was really working quite closely in the insurance arena to, really work on things like program integrity efforts. I'm trying to be very mindful of the time, but am I answering your question?
Certainly, thank you.
You're welcome.
Tiffany, what are we doing on the first 45 minutes?
Dr. Jameson, do you mind repeating that question? There was a little bit of feedback.
I believe we're at 45 minutes, so I have a question for the board. We still had 2 more questions to go. If the board would like to extend it 5 minutes, and then of course every candidate would be given an additional 5 minutes. Board, open for your input.
It works for me.
Works for me.
Same.
Well,
And I saw Levon Lewis's hand go up as well. So anyone uncomfortable with that? It sounds that the board is unanimous about allowing you another 5 minutes. Or we'll start with that for the last 2 questions, which will also be additional time for the other candidates. And the last 2 questions will be by Levon Lewis, question 11 and 12.
Good morning, Jennifer. I am sorry. My camera is not working and I'm going to have to leave the meeting and come back in to get it to work, but I didn't want to do that during this interview. So my first question, my first question is, if selected to serve as the executive director for the exchange, what would you consider are critical leadership skills needed in order to manage and provide leadership for a diverse staff that serves a diverse community?
Yeah, absolutely. I think that the most critical leadership skills would certainly be humility, a willingness to listen to all points of view and all all feedback, and be able to ingest that information in a responsible and respectful way, and make sure that you're able to put that into practice. I think another really critical, a very critical element of leadership would also be the ability to make decisions and validate those decisions, which is really like, explaining like why that decision may have been made. Because like I said, when you are in a key leadership position, there are times when you're not going to be able to, fully give everybody what they want. And so it's very important to be able to make decisions that are sound and based on good judgment, but that, you're able to provide your rationale for. I think that was I really learned that lesson well when I was on the State Board of Nursing. I mean, we were having to make decisions about, many various issues, but, critically, whether or not we felt like somebody was safe to practice. And in that role, I really realized how important it is to be able to explain your rationale for making a decision. And so I think that that is extremely important as a leader, but also the ability to make decisions quickly is also important. I mean, the healthcare landscape changes quite frequently, and adaptability, I think, is another very critical leadership quality. So in terms of, I'm sorry, could you please repeat the second part of the question, Ms. Lewis?
Well, I can repeat the question. If selected to serve as the executive director for the exchange, what would you consider are critical leadership skills needed in order to manage and provide leadership for a diverse staff that serves such a diverse community?
Okay. All right. So yes, as just, I guess, to paraphrase, like adaptability, humility, ability to make strong decisions, but also be willing and able to receive feedback and opinions from your team, from other stakeholders, as well as strong judgment.
Thank you.
Thank you.
Can you share with us any initiatives you have directed to engage the diverse communities in Nevada?
Yeah, absolutely. So when I was population health systems manager in the Division of Public and Behavioral Health, one of our cancer prevention programs that I oversaw and directed was our Women's Health Connection program. One of the concerns that we had was, we did provide services for a lot of uninsured women, cancer screening services, and oftentimes we had significant barriers that women had experienced when being able to make it to their breast and cervical cancer screening appointment. So we did a lot of work to mitigate a lot of those barriers. So we engaged community health workers who made regular phone calls with those women. We would set them up with childcare. We would set them up with taxi vouchers so they could get to their appointments. And, we would work with them to really, and also do a lot of work to help these women understand the importance of getting these screenings. And those services were directed towards uninsured or underinsured women who were falling below, the federal poverty guidelines. I would say another effort that I did lead was writing, and it's just now going into implementation. I saw from the fiscal and operational report for the exchange, but the state-based exchange modernization grant, where this was a evaluation plan that I had written based off of a study that was done with Covered California, to have our call center representatives actually make 3 phone calls to consumers who were denied Medicaid services to connect them with either an agent or a broker on the exchange or a navigator to help get them signed up for coverage. That 3 phone calls was based off of our experiences that we found at the Women's Health Connection program, because usually by 3 phone calls, we had enough attempts to where we were generally able to get a woman on the phone that would explain, why or why not she was able to make it to her appointment. So we wanted to gather that data for our consumers who were being transferred over via the account transfer process, so that we understood clearly, the qualitative reasons why people were or were not signing up for coverage. So that was kind of a lot of information quickly, but those are 2 direct initiatives to help that I led to help increase equity. And a couple of other ones is really working, like when I was on the State Board of Nursing, and this was not solely me by any means, but, making the recommendation to move towards autonomous practice for nurse practitioners because, one of the things we were experiencing in Nevada is that we didn't have enough physicians who could oversee APRNs, but also, populations that experienced more disparities were more likely to receive care from nurse practitioners versus traditional physicians. And there was a greater level of comfort, studies and data had shown with nurse practitioners. So in that vein, it was important to increase the provider population and increase the provider population with groups that were more representative of Nevada's demographics through autonomous practice.
Thank you.
Thank you.
Thank you so much. And what I would like to do now is actually give you an opportunity to ask us some questions. But first, if you were to be selected as the executive director, when would you be available to start working in this position in Carson City?
Yeah, as soon as August 8th.
Excuse me?
August 8th. So
I think she said August 8th.
Yes.
Oh, August 8th. I gotcha. Okay. August 8th. Okay. I thought you said out of state. I couldn't quite.
No, no, August 8th.
Okay. And now this is the opportunity where you can ask us questions. I'm sorry, our board member first will ask, do any of our board members have any questions regarding the information that the candidates submitted in the resume first?
And also, Dr. Jameson, sorry to interrupt, just for clarification, that any questions from the board can be based on the resume or any clarifying questions based on any statements that she's made during the interview.
Indeed, the resume was pretty self-explanatory, so I hear no further questions on that. And I do think you did a good job of thoroughly answering the other questions. So it sounds as though the board has no further questions regarding your prior answers. So lastly, do you have any questions or disclosures or anything that you would like to discuss with the board so that it will assist you in evaluating the process?
Absolutely. Thank you so much. I guess my first question is, how much time do we have? I do have some questions, but I do want to be mindful of yours and other candidates' time.
This particular section will be 15 minutes, and I think we're just a couple minutes into it. So you have over 10 minutes to just have any questions or disclosures or anything that you would like to discuss with the board.
Thank you. I did have a few questions. First off, I do want to again thank the board for their time and for meeting with me. I recognize I do give a lot of information in a short amount of time, so I'm hoping to slow down a little bit here. But one of the questions that I did want to ask of the board is, as a board, what attributes and characteristics does your ideal executive director have?
Tiffany, could I ask if a couple of our if there's any guidance we can get from our DAG, or if it's comfortable, if that's a question that would be appropriate for our board members to address, given that it's almost the reverse of what we asked our candidate. If you follow me, is that somewhere we would go?
excuse me, Mike Denman for the record. The reverse of what was being asked of the candidate, in the sense that the board was looking for what she has to bring as the executive director, and she's asking what the board is looking for.
Yes.
I don't know if there's anything specifically precluding that question, but I don't know if there's anything necessarily precluding the board from answering or not answering it either.
Okay. Is there, I would like our board members, if there's anybody who would like to mention anything, the things that would be most important to any of you or any one of you that would care to respond, of what we are looking for in a executive director. I do believe I would start with a, I always save my comments for last after our boards have an opportunity to speak first, because I also tend to say a lot and I like to give our board the opportunity first. Go ahead.
Madam Chair, Valerie Clark,
Yes.
I would just state from my perspective that we've got a really, really good team of human beings at the Exchange. It's a very human system. It's been a great team for a number of years since I've been on the board for the last 7 years. And what I would be looking for is someone who is a true people person, a servant leader, who is able to herd a high functioning group of people in the direction that they need to go, giving them ample support and taking their skills into account, and letting them function at their highest level, their highest capabilities. That's what I would be looking for primarily.
And Stacey?
Yeah, Stacey Weeks from Nevada Medicaid. I would really like to see someone come in and be able to help move us forward. We have still an uninsured rate that I think we need to, do our best to, as an exchange, to get at. Even parts of it can be challenging, and some of it relates to Medicaid, but I would like to really think about how we can better partner with the exchange. Other states, that is very much together, one website. So I'm just throwing that out there, and I'd like to see some forward thinking on that and really thinking about how do we move forward and not just sort of be siloed. We're really moving together on uninsurance. So that's something I would like to see. And then also, obviously, for a leader, looking for someone who has a vision for where Nevada should go with this exchange, to make sure we're still at the forefront of healthcare in the country. So that is where I'm at. Thank you.
And did we have any other comments?
Madam Chair, Commissioner Richards, or sorry, Commissioner Kipper has his hand raised.
Oh, Commissioner Kipper, please.
And good morning again. And I would just echo what Ms. Weeks had to say in regards to Medicaid and apply it to the Division of Insurance. And, looking for a leader who is able to drive that team in a collaborative effort with both the Medicaid Division of Insurance and the Exchange to really address the health insurance challenges that face us with that uninsured rate.
Thank you so much. I think that those three input is an excellent response to that question. And so in order to, you said you had some other questions before our time is up. Would you like to ask those questions?
Absolutely. And I think, that some of where my next questions were going were actually just answered by, the responses that we had just received. But, one of the questions that I had wanted to ask is, how would you define success for the incoming executive director, and what things do you think the exchange is doing well at this time, and what things would you like to see the exchange change? And so those, I feel like I got some really good responses and understanding that, the board is really looking for, vision, direction, a lot more collaboration, which I'm very excited to hear about, as well as being able to, lead this. And this is an exceptional team. I've worked with most of these team members that are still here, that are, at the exchange. And you guys are right. This is a really, really exceptional team, and one that would be an absolute privilege to lead. So I absolutely thank you for that insight. I guess my final question would be, is what would the board like the exchange to accomplish, in the next 5 years?
Thank you. I think some of that indeed was already incorporated in the response from before, is particularly addressing that our goal is that no one in Nevada is uninsured and everyone has access to healthcare. And so we have more work to do there with the broad mission and vision of the exchange. I'd like to ask any of our board members if they want to add comments to that. Do you see any hands up, Tiffany?
At this time, Madam Chair, I do not.
So as I mentioned,
Actually, it looks like sorry, Madam Chair, it looks like Stacey Weeks has her hand.
Yeah, so I'm sorry, it cut out whenever Jen was talking. So I had a hard time hearing the whole question. So I apologize. Do you mind repeating just simply kind of what you're looking for?
Yeah. What would you like to see the exchange accomplish within the next 5 years?
Yeah, I think to Dr. Jamison's point about uninsurance, but really not just having the big vision of that, but like, what are the practical steps that we can take to get there? Like, that is something I don't think we ever, sometimes we talk big, but we don't have the practical steps of getting there. And then what are the practical steps? How much does it cost, right? Like the reality of state government, right? And like, how are you going to actually get that done functionally? I think that is something, I mean, it's just hard. Sometimes we just talk a lot about it, but we need to figure out what are those problems and then figure out what are the solutions and which ones make the most sense for Nevada. Because we have a hard time getting Nevadans to enroll in healthcare, especially frontier areas, and really figuring out together what are the practical solutions to getting at that situation.
Thank you, Stacey. I think that we don't see any other hands up. Tiffany?
Yeah, at this moment, not seeing any other hands, having other questions. I would like just to make a comment real quick. Monique Williamson, our representative from Agency HR, did just let me know that since this last question of the group of questions is an open-ended question that's directly asked by the candidate, that the board that they are permitted to ask whatever they wish and the board can respond accordingly. So just to your original question, Dr. Jamison, as far as, is this an appropriate question to ask? Any questions that the candidate asks, any candidate asks, it's appropriate for the board to answer.
Excellent. Thank you so much.
For future reference. So
thank you for that feedback. And I think that would be the case since every candidate is kept in a room of walled off, so that I think that's all fine. Okay, I want to very much thank our candidate, Jennifer Krupp, for this interview. And we appreciate the application and the process, and we understand that they are challenging, and we appreciate so much that you have brought yourself here today for us. It means a lot to us. And so we will be continuing today and doing the next 2 of 3 candidates. And then after that, I believe they have shared with you the rest of the process. At the end of that time, our board members will have discussions and we will have further input from our ex officio members and our other staff will be commenting, and then we will proceed to make a vote. So we thank you very much, Jennifer.
Thank you again. I sincerely appreciate everybody's time. And again, thank you all. And I'm really hopeful. This really would be, you know, a dream job for me with a team that I truly enjoy working with, care about tremendously, and it would be an honor and a privilege. So, like, I very much would like this job, but thank you again so much for your time, everybody. And I look forward to hearing more later today. But I do sincerely appreciate the opportunity to meet with you and ramble along. And I'm just very excited about this, and thank you. This really would be an honor and a privilege, so thank you. And it's been an honor and a privilege to be able to meet with you today, so thank you.
And thank you again. Have a wonderful day.
Thank you, you too.
Madam Chair, Tiffany Davis for the record. So Caitlin will go ahead and move Jennifer back into the waiting room, and we'll wait for her confirmation. And Caitlin, can you confirm that Jennifer Krupp is back in the waiting room for us?
Hi, yes, Caitlin Blagan for the record. Jennifer has been moved into the waiting room.
Okay, and Madam Chair, at this time, do you want to proceed to the next candidate, or would you like a small break? And that would be up to the board's discretion.
Yes, originally, what we had thought was to go ahead and do at least 2 candidates prior to lunch, a break for lunch, which we thought would be 30 minutes. Is that correct, Tiffany? Yes, and then we will leave the Zoom going through that time just to on and return at 30 minutes. Now, if the board would rather stop now and go to lunch, that is your option. And also, there is always the option of doing all 3 candidates and then of pushing through. So I would entertain any recommendations by the board at this time, and ex officio members as well. Shall we just go ahead and proceed with our next candidate, Troy Johns?
Works for me.
Yes.
Okay.
Dr. Jameson, can I just ask a quick question?
Please.
This is Sarah Friedman for the record. I'm wondering if it would be okay for me to split up the second question that I'm asking to make it more digestible for the candidates, or if I need to repeat it in the same way that I delivered it for the first interviewer. Would it be okay to make that a small change just to make it easier for the interviewer to digest?
Well, is there a comment from our DAG on that?
Mike Demner for the record, I would defer to HR if they have a different perception of it, but I think substantively, if it's the same, it should be fine.
Tiffany Davis for the record. Looks like Monique just joined us. Monique, do you want to help us with that clarification?
Yeah, Monique Williamson for the record, and I actually agree with the DAG. As long as the substance remains the same, then it's okay to tweak a few words here and there.
Okay, thank you for the clarification.
And have we now, I think any other comments or questions from the board? And if everyone is comfortable, we can move Troy Johns into the room, on our Zoom.
Madam Chair, Tiffany Davis for the record, that sounds good. Caitlin, go ahead and move Troy Johns into the main room.
Caitlin Blagan for the record. Troy has entered the room.
Tiffany Davis for the record. Troy, you're in the main meeting room for your interview. So just wanted to confirm that you can hear us.
Yes, Tiffany, thank you.
And will we be having a picture, Tiffany, Florence Jameson?
I believe he was working on that.
Very good. Okay. Welcome, Florence Jameson. Chair of Exchange. Welcome, thank you very much, Troy, for joining us and for your application for this position. We're excited about the interview today, and we have most of our board members present, are ex officio members, and you will be meeting some of them throughout the interview. Various ones will be asking questions. As you're familiar, there will be 12 initial questions over 45 minutes, and Tiffany will go through reminding you when you're at 30 minutes, and then we will have a final wrap up of 3 questions. So Tiffany, do you want to make any comments before our first question is asked?
I think you're good to start, Dr. Jameson.
All right, Dr.
Yeah, to your point, I will be doing a 30-minute mark, and then also there was the added time. So as we get closer to the end of time, I'll pop in and alert everyone how we're doing on time.
And just how much added time will there be?
There is an additional 7 minutes added.
Okay, so we expected 45 minutes for the first 12 questions, and we went to 52 minutes. And in all fairness, you will be given 52 minutes if you desire for your first 12 questions. So first interviewer is Dr. Friedman.
Hi, good morning.
Good morning.
My first question is, what are 2 or 3 professional principles that would guide your conduct as an executive director?
As the executive director, I think transparency has got to be one of the top considerations for the executive director. It's a very public position. The constituents and the legislators and the executive branch, the collaborating agencies and our partners, we owe all of them a great duty to do our very best to manage every aspect of our program and do it cost effectively and do it in a way that makes it as easy for everybody, each one of those partners, to work with us. And I think to carry that out in a transparent manner is paramount to success. I would also say honesty and integrity. That I want to throw reliability out there, but I think we've covered that. But I think that it's important to demonstrate integrity 100% of the time, and that's very important for staff too. As we invest in staff, there's never been a more important time to focus on the culture of people and making sure that everybody's aligned. And I think that demonstrating integrity and leading by example and leading through service to others, that's also a very important principle to bring to the table.
Great. The next question has 2 parts. So if you could first describe your leadership style.
My leadership style is to try to collaboratively identify where we want to put the ladder for the wall that we want to scale. So where do we want to go? Let's get everybody on the same page with respect to what are our opportunities and how can we get there. Then we can identify our strengths and weaknesses, the opportunities and threats that might be a challenge to achieving that. And everybody on the team and our collaborators and our partners and everybody that's a stakeholder with the exchange can play a role in helping us establish what the greatest opportunity for us is going to be strategically. And so I think then it's very important from leadership perspective to be as clear as you can about here's how we can get there, and then work and build a management structure that supports that from a process perspective.
Thank you. And the second part is to provide specific examples of how you can envision your leadership style being effective in changing 3 things: organizational culture, building successful teams, and resolving serious or long-standing conflicts.
Well, let's think back just to transparency, and I think that is that's a foundational element for building trust. And so if we have trust and we can establish a trust with our team and stakeholders, really everybody involved, we can, the sky's really the limit of what we can do in a collaborative manner. So I would say that basis of trust, and I think we also want to focus on empowering individuals to carry out their duties as best they can, be available to them to help them out when they need it. And with that basis of trust, empowerment, and allowing people to grow in their positions, I think that we can have a team that's very responsive, very consumer oriented in terms of getting back to folks. And it's inevitable that conflicts will arise, but if you have a relationship built on trust and transparency, then it's much easier to bring folks together to resolve issues that exist that are an impediment for the organization's goals or for serving the customer effectively.
Hey, thank you.
Our ex officio member, our next question by Stacy Weeks.
Hi.
Show this too.
Good morning, Stacy Weeks. I'm from Nevada Medicaid. So this job involves immense pressure from stakeholders, which includes insurance agents and brokers, carriers, state lawmakers, consumers, small businesses, just to name a few. The list does go on. How would you balance these competing forces in your new role as executive director at the exchange?
Thank you, Director Weeks. It's a pleasure to meet you, as it was you, Dr. Friedman, and Madam Chair. Thank you for welcoming me to the meeting today. You know, every day we're dealing with multiple stakeholders, so I see this as an exceptionally challenging aspect of this position, and not naive about it at all. There are dramatic competing interests, and I think we're probably already sensing those as the political nature of the state comes into play, and you know, even as we look at statewide Medicaid and the public option. So I think that it's just absolutely vital to get out as early as possible and meet as many people right where they are as you possibly can, and have a fundamental personal relationship with as many as possible and know exactly where they're coming from. Be a very empathetic listener, and you know, there's nothing short of it taking just a ton of hard work and a lot of time. You know, early mornings, late nights, and busy weekends. And I don't think that there's any other way to do it. I think the exchange staff is really outstanding, and what they've been able to prove and accomplish over so many different generations and major changes in healthcare is a demonstration that the executive director that you select really gets to be focused on being out there more than they would if they had a lot of just pure operational challenges to deal with. So I think listening and being ready to take action, and you don't let anything sit. You just have to move all the time. And it's busy. I've been involved in startups for healthcare organizations, dealing with most of the constituents that I will from a private business perspective, some of the same constituents that I'll be partnering with, like you and the Commissioner of Insurance, in this position from the private side. And so, you know, I know what a pressure cooker that is and how little time it feels like you have, and you have to move fast and stay on top of everything. And, you know, I think that's really how I'm going to have to do it. And there's a great team to work with. I have the sense that the collaboration between the agencies and the state is excellent. And I believe that's a great groundwork to make good things happen.
Thank you. My next question for you is two parts. So I'll start with the first, because that way you can answer that and then jump to the next piece. So when you look at exchanges today, especially state-based exchanges, what would you say the biggest challenges are facing exchanges, especially when it comes to achieving their goals and mission as outlined in the Affordable Care Act?
I think that I think that we're moving to value-based care. And that is a challenge for how that can be implemented effectively in the rural communities. And those, the prospective membership, the uninsured with respect to the exchange, really need to have great access to great care and value-based care. But we have to be incredibly creative and partner-oriented to figure out, well, how can we make that work where there's not a great balance of access, not a great number of providers or different healthcare organizations to interact with. So I think that's a big challenge that ACA has, and how that will be implemented effectively in the state. And the exchange is in a great position. We're going to truly benefit by how that comes about. It's frankly exciting to think that we might have new tools and new offerings for the different constituent groups, especially in rural communities. The fact that we can deal with health disparities and equity matters in every county that we operate in, that's exciting too. We're really getting to some of the fundamental issues that have prevented people from living their best possible life. And so I think that that's a big challenge, but I think it's also a great opportunity.
So the second part of that question is, how would you help address these challenges in Nevada, considering that its unique environment?
We've talked a little bit about how good the staff is at the exchange and how that really positions the executive director to be out there. So I would like to go to the places where we are not reaching the uninsured, where we are not making connections for people who are eligible for our coverage. Why isn't it being adopted? I'd like to spend some time and understand, well, why is that, and figure out what we have in our toolbox, our resource space, to address that and fix that. I'd like to spend time with the organizations that are building the healthcare infrastructure that we are representing to the membership there, the carriers, the different your department, as you work with the carriers to develop managed care options in these various locations. So I think being out there and paying attention and really listening to figure out what the barriers are and addressing those with respect to what our members need and what our partners need is the best way to proceed on that basis.
Thank you.
Troy, great to see you. Thanks for joining us. Jonathan Johnson, we've got the next couple of questions for you. As you know, the exchange is responsible to the state of Nevada for proper fiscal management. Please take a moment to describe any legislative and fiscal experience you've had or any experience working with budget planning. Moreover, please explain if you're familiar with the state of Nevada's legislative process for submitting budgets.
When I was with a large health plan, national health plan based in Arizona, we had 147,000 members and about $200 million in premium. I had 26 direct reports and then worked in a distributed manner with operations, for enrollment, eligibility, billing, and all of the aspects that are involved with having a diverse portfolio of managed health benefits. And so through that process, I have experience with budgeting processes that are on a similar scale to what the exchange is. And working departmentally to help make sure that people achieve what they need to from an allocation of resources and then making sure that we meet the budget parameters. Also responding to urgent, unexpected things that sometimes challenge us from a budget perspective. Also in Arizona, I had clients that were senators and congresspeople. And so I have direct experience dealing with people as a member of a health plan that then we also had to talk to about how they're going to pay and how that gets allocated from a budget perspective. With respect to the state of Nevada and the biennium, you know, I'm pleased to see that we have a budget that's been passed and that we're able to work from that. And so I have a little bit of time to spend with the actual budget for the exchange should I be selected for this position. But I understand how that builds over a 2-year period and how important it is to meet with the Assembly and the Senate and the executive to understand where they want to take it and where it goes, and then be an advocate for that process and be readily available to help interpret and identify exactly how an idea that they have might impact the exchange and how the exchange could adapt to it should it be become law and have to be funded and supported.
Perfect, thank you. What public speaking or like media experience do you have? For example, responding to media inquiries, any public relations experience, and how have you handled potential negative or difficult questions from statewide or national media?
I have had some public speaking training, and it's very beneficial. I approach that with the thought that if you have 5 seconds to present something, you better get your key points made in those 5 seconds. You may talk for 10 seconds or 30 seconds, but if you don't make those points in your first 5 seconds, you're probably not going to get them heard. And I would say that there's a tendency today with social media for that soundbite to continue to be compressed. And if you do continue to talk for the 30 seconds, whatever you say might be used against you. So I think that we have to be ever mindful as a public servant what our role is, what is appropriate to say and how to say it. And if you don't know an answer, you own that and you move forward and find out the answer. Most of my experience has been with representing companies in public settings, doing very large product launches with broker consulting communities, conducting countless numbers of enrollment meetings with different constituencies, including legislators, and that's a tough audience. If you want somebody who knows about healthcare from every perspective and wants to advocate for their point of view, as it may differ from a managed care organization that you represent, that's the crucible that you're in that scenario. So I've had to deal with those, and you know, some of those things that we talked about with Dr. Friedman early on about honesty and forthrightness and transparency, those things will carry the day, and we will always be represented well to the best of my ability should I have this position.
Perfect, thank you.
And our next questions come from our board member, Valerie Clark in insurance.
Thank you, Dr. Jameson. Hi, Troy, how are you?
I'm well, how are you?
Good. How would you rate the importance of transparency in the executive director role? And what methods would you use to promote transparency throughout the organization?
I would rate it as critical and, you know, vital to our success. And Ms. Clark, when I think about how important it is, coming out of the pandemic, you know, one of the things that a big lesson for me has been, you know, culture. I just can't say enough about my present views on how important culture is. And it's easy to think that people that we deal with are perfectly aligned with our mission because our mission is written down and we've articulated that. But it's really going through a lot of filters in an individual's life, and how they interpret that and their role with that is is really an important thing to understand, to empathetically understand, and try to really figure out where people are coming from. And I just don't think if the executive director doesn't act in a transparent manner, that the staff is going to be able to perform at their best, because they're always going to wonder exactly, if I share this, exactly what's going to be done. And so, you know, I think it's vital to be really focused on helping people get where they want to be from a career perspective to the degree that we can while accomplishing our mission. And that if I don't start, if the executive director, whomever it may be, doesn't start with a transparent perspective, I just don't think we're going to have the trust that we need to advance. So I can't say enough about how important that I think it is. And I think it's very important to build a culture where people have that sense of transparency. They're respected for having a point of view, and their point of view is we try to take that into account to really do the best work that we can.
Thank you. Next question, please describe your philosophy and approach when making big decisions that will affect your organization.
Time permitting, I think it's great to lay out exactly what the challenge is, what the opportunity is, and bring together representatives from all the different functions, and really start from a ground floor of, hey, what do you see that we can do here to make this happen? What can you do individually to make this happen? You know, what can you if you're representing a team do? What can you do as a department? You know, so whatever your functional area is and the degree to which you can, do that at a grassroots level from the very basic person who's the last one to touch the customer. Start there. Find out what our clients think about the opportunity and what's important to accomplish, and then build a plan that has benchmarks that people agree to and buy into what those benchmarks are, and then find a way to make sure that we are making the progress on those milestones that are leading to the result or the plan that we developed. And you know, we're back to transparency. Let's outline what those goals and those benchmarks are up front, and make sure people have the resources to get it done, and hold them accountable to doing it. And I think we can. I think every organization has an opportunity to do that. And your new executive director has a fresh opportunity to build that kind of culture and to approach new opportunities and challenges that way.
Thank you very much.
Thank you, Valerie. And moving on, Scott Kipper, our commissioner, our insurance commissioner, has a couple questions.
Morning, Mr. Johns. Again, I'm Scott Kipper from the Nevada Division of Insurance. My questions are, has the exchange implemented a new eligibility and enrollment system? And thus this position works very closely with contracted vendors, especially the new contracted technology vendor, Get Insured. How do you see your role in managing the exchange vendors? And what would be your approach to problem escalation?
The executive, thank you, Commissioner Kipper. It's a pleasure to meet you. It's the executive director is responsible for everything that happens in the exchange, and that includes the vendor relationships. I see the vendor relationships as absolutely vital to our success. I'd like to see the vendors appreciate us as a key distribution channel for them. We can solve marketing and sales support roles for them that really can help them manage the expenses of distribution in a constructive way. You know, working with brokers and navigators, I think that that we, if we are not for any reason, I think we can develop those relationships so that we are respected as a great value add to the carriers. technology platforms and those vendors, a little bit like the discussion with Ms. Clark about accountability. I think it's we lay out and have contractual relationships with what everybody needs to do. We do our absolute best just to make sure everybody can perform to that standard. And if there's a resource issue that's from our perspective, we get it addressed right away and solve that problem for our partner. And if it's an issue on their side, we work with them to achieve the service level that they've agreed to do in a constructive manner. I like the structure from a management or leadership perspective where whoever's responsible for the front of that relationship and that relationship who has that responsibility, I'd like to see those folks work through the issues to the greatest degree possible and be a support in the background to the need, to the level that's needed. However, some situations, perhaps because of who's involved or the degree of the issue, might require executive director role very early on. And I'd like to make sure that I'm available to my team who is directly responsible for whomever that vendor might be, whether it's Get Insured or the carrier, be ready to step in as they request.
Thank you. Also, the second question is, would you please share with the board your specific experience in the field of individual health insurance and maybe a little bit of a focus on your working knowledge of insurance rating principles and processes?
I'm pleased to share that I have quite extensive history of working in the underwriting process and market rate submissions to divisions of insurance in multiple states, and building the cost basis, working with underwriters and actuarial professionals to present rate filings to divisions of insurance, and then being part of the team that responds to the questions about the adequacy or inadequacy of the rate, or how marketing and sales operations might play a role in being able to achieve either a rate that's aggressive in the market or above the market based on the healthcare experience. I have had a significant amount of training in that underwriting process, primarily for group health benefits. However, when I was in the Colorado market, we established a plan that was very unique at the time. It was before the kind of the present phase of association plans for the Denver Metro Chamber of Commerce, and it was quite an undertaking just to get my own healthcare organization willing to underwrite that with some of the dramatic changes that can happen with an employer group of two, where somebody age 20 is replaced by someone age 60, for example. And so we were successful in demonstrating the opportunity for that, and then working with the underwriters and actuaries to present a plan that was adopted by the Denver Metro Chamber of Commerce at that time. And so I apologize if I've gone on a little bit too long, but been involved with rate filings and feel like I have a very good grasp of the underwriting principles.
Thank you.
Thank you. And going on to questions 11 and 12 asked by Levon Lewis, our board member.
Ms. Lewis, I believe you're on mute. Are you having technical issue? Oh,
thank you. Thank you very much. I'm sorry, I was on mute. Good morning, Mr. Johns. If selected to serve as the executive director for the exchange, what would you consider are critical leadership skills needed in order to manage and provide leadership for a diverse staff that serves such a diverse community?
Thank you, Ms. Lewis. always listening and trying to meet people where they are and understand their perspective and bringing their perspective into consideration in everything that's done, so that you're showing the proper amount of sensitivity and you're finding ways to help address what everybody's or anybody's issue or concerns are. You know, we just have to understand that there are all kinds of challenges that people have faced with places where they work, gaining access to healthcare coverage. And we have to do whatever we can to make it easy and simple for folks to make progress and adapt to whatever opportunity they want to pursue in a way that they feel there's nothing in their way. And so removing barriers, I think, is absolutely critical to doing that.
Ms. Lewis, sorry, my apologies. I don't mean to jump in here. I just wanted to let everybody know we're at our 30-minute mark.
Okay, thank you. Well, I have one more question. Can you share with us any initiatives you have directed to engage the diverse communities in Nevada?
Yes, Ms. Lewis. I am presently the president of a nonprofit organization, and it's a nonprofit organization where none of the officers or directors are paid. So it is a labor of love. And our focus is to help the food insecure. And this is a very marginalized community, and many of them homeless, and they are not a group of individuals who are accustomed to being cared about and being served in a dignified manner. And I have been involved with that organization for over 20 years. And we do whatever we can to open our doors and provide a nutritious sit-down meal that's served by volunteers in a very dignified manner. And many of these folks have no other option for a meal given on any given day. And the only price for admission we have is good behavior. And so, you know, that is a very underserved population, and I'm just pleased to let you know that over the course of the year, we'll provide 25,000 sit-down meals served in a dignified manner, and we'll make eye contact and show a lot of love to folks who would not otherwise have had that option.
Thank you.
Ms. Lewis, if I may also add that in reviewing the different leadership positions that I've had where I have been a director or a department leader, I have been able to increase the diversity of the work staff relative to where it was when I started.
Oh, thank you very much.
Thank you, Yvonne Lewis. And you did not use all of the time allotted on our first 12 questions. I don't know if you wanted, reflecting back, to say anything more. We are now otherwise proceeding with the next 15-minute segment, which is the last three questions to the round of our interview with you today. And the first question is, if you are selected as the executive director, when are you able to start working in this position in Carson City?
I believe August 28th is a Monday, if I'm not mistaken. Does that sound right?
Tiffany?
Double checking. Troy, do you please mind restating that for me?
Is August 28th a Monday? I believe August 28th is.
Yes, you are correct. Tiffany Davis for the record, August 28th is a Monday.
Thank you, Madam Chair. August 28th.
Thank you very much. Which would,
If I may, should I have the privilege of this role, and depending upon whatever the HR guidelines are for the state, I would appreciate starting to get read into any issues or items that are underway or developing that will need immediate attention even prior to that date.
thank you. And at this time, I want to give an opportunity to our board members to see if they have any questions regarding the information that you just shared with us on the questions that we asked, or on the submitted resume. That any of our board members have any questions?
Madam Chair, Valerie Clark, I have just one clarifying question from the resume that you submitted, Troy. So I see that in your professional summary, you state that you have over 30 years of healthcare management and business development experience. Then when we go down to the experience section, you state that you've been the president of your own company since August of 2001 to present. And then there are several other jobs that you've held, going back to independent consulting, MedWire Corporation, all the way down to your time with Lincoln National Life in Dallas, Texas. But you don't put the dates that you were with those companies. And you don't have to go through, a lot of detail, but I was just trying to get a feel for how much time you spent in the companies that you clearly, all the different insurance companies that you worked with prior to, I assume that was prior to 2001 then?
Yes. Yes, it was. Let's see here. Right before consulting role, about 12 months before I was serving as a consultant for the current company that I work for. I was hired from that consulting arrangement, or introduced to that consulting arrangement, and made a move there.
And you don't have to give me specific dates. I'm just trying to get an understanding of how much time did you, was that the remaining 9 or 10 years in the 30 years that you talk about, or is there a different time frame?
Yeah, let's see. For Lincoln, it was around 5 years, and MetLife around 6 years. MedWired, that business was sold. That was about 2 years. The health plan that we developed, Frontier Community Health Plan, was about 2 years. And I'm happy to get you the specifics. Actually, if you, I might have a resume on this computer that I can pull up for you. I guess a key point that I would like to make for you is I have the ability to be in a position for a long time, and that may be important. The executive director serves at the pleasure of this board, and so if ever you're not satisfied, of course that would be a challenge for the executive director. But I think that one of the strategic advantages that I bring is I do have extensive tenure at some organizations for a long time, and in my current role for over 20 years. And that can be something that brings a lot of continuity and allows the exchange with a long tenure maybe to develop in new ways that it couldn't if there's a lot of turnover.
Yeah, no, nothing negative insinuated. I just was trying to get a feel for, the times that, was it a year in each company or more than a year? It just tends to give you a general idea of the experience level and the accomplishment, maybe what have you. So that's a great answer. So thank you.
Yeah. and all of them more than a year, and some of them several years in a row. And it's kind of interesting when you have a career and a resume that goes back in time. Some of the advice is to stop adding dates to it. So it's interesting. I didn't think that was a particular issue, and I'm happy to share all of that with you.
Yeah, no worries. Thank you so much. I appreciate it. I'm in the same boat, so I have a lot of stuff in the old resume. Thank you.
Thank you, Troy. I myself appreciate the elaboration on that. And it seems as though indeed in several of those places you were there several years, up to 5, and that did show good commitment. And the last one you listed quite a lot of years. So thank you. And I would like to ask if any of our ex officio board members who are so invaluable in providing us with good insight have any further questions, and our board members any further questions regarding the information that our candidate, any of the answers they gave us earlier that you would like clarified or elaborated on, or if anything else on the resume. So I don't, Tiffany, do you see any other hands up or any other?
Madam Chair, Tiffany Davis for the record. I do see that Stacy Weeks has her hands up.
Sorry, I always have a question. You got to give us a little more time, Dr. Jameson. I got to find my little hand on here. If we were in person, it wouldn't take me as long. So thank you, Troy. I thought your answers were really good. I think the question I have from your resume is thinking about working in state government and sort of, which roles do you think really prepare you for sort of this role? I know the exchange is sort of a hybrid from state government, but it really truly does function to and impact state government in Nevada and all the other systems that rely on the exchange. I'm just curious, your experience in that realm and sort of how your other experience can maybe build your ability and capacity to work in state government.
Thank you, Ms. Weeks. I really cherish the opportunity to address gaps. I think we have the greatest country in the world, and we live in a great state. And when you see something where the market just isn't quite doing everything it should, you want to figure out, well, how to do that. And how do you do that based on the principles that make this country great? And I think, entrepreneurism is part of that. So I believe kind of approaching this with an entrepreneurial mindset is an opportunity. I think it's a great strategic move for the exchange to say, well, let's find somebody who looks like a lot of our stakeholders in terms of their background and experience, and what might happen with them in the mix. And there is just absolutely no absence of talent for the perspective that I don't have as a hands-on administrator for a governmental organization. I mean, the Commissioner of Insurance, all of the people I'm surrounded with at the exchange, should I have this position, I just think it's a great strategic opportunity for us to work together and find out new creative ways to address the gap, and that is the uninsured population in Nevada. And maybe with a combination of a different perspective in the executive director role, we're going to find something new. I'm kind of counting on it, and I'm looking forward to it. I think that the time before us with statewide managed care and the public option, both supposing to occur on January 1st of 2026, I think there are so many opportunities for collaboration. I love the work that the exchange is doing in conjunction with Medicaid to address the redeterminations. You look at things aligning and you say, boy, there's a lot of opportunity to do some good work here, and your perspective might be a positive catalyst that's what brings me to the table in a very excited way about the opportunity and being part of the team, that you're on, working with the exchange to help cover those folks in Nevada that aren't covered.
Thank you.
Thank you. And our final question, lastly, do you have any questions or disclosures or anything that you would like to discuss with the board so that it will assist us in our evaluation process?
I'm very interested in what you would see as priorities for the first 90 days for your next executive director. I'm very interested to have thoughts about the intersection of the public option and statewide Medicaid, managed care Medicaid, and how those things might come together, and how the executive director could play a role in that. So those are a couple questions that I would be very interested in knowing about.
Very good. I'm going to open that up to all of our board members. And who would like to take the first question? Although, a lot of us are wondering about those things as well, because we haven't yet got all of that figured out, as you know, yet between the legislature and our the exchange. There is much to be written. As you know, when it was passed, it was, as sometimes happened in the legislature, first it was passed, but it hadn't really been studied. It had to be studied, and it's in process. So a lot of us would like to know that as well. But let me see what insight we have from some of our other board members. Stay. I see your hand up.
Yeah, so as the administrator over Medicaid and some of the work on the public option, I'm happy to answer what I know at this time. I will say the biggest priority we have right now is statewide managed care. Our mission is, around really improving access to that to coverage. So we did get funding. I will tell you, my division is also dealing with the unwind, as well as 55 more projects to implement. Medicaid is never bored and always busy. The public option work, I will say, sort of right now, the application is, posted on our website. And some of that, if you have, you can look at it there, the 1332 waiver, if you're interested in that. But for now, our focus really has been on trying to get all the things that we need to implement by January 1, 2024, some October of this year done. And so I will tell you, we are just doing our best to survive. So having a good partner at the exchange to help us navigate some of these statewide issues will be really helpful, as well as our work with DOI, because we have a lot on our plate and we are understaffed. And I'll be honest, we're just trying to get the basics done and keep the lights on. So that's where we are right now.
Very good. Thank you. Thank you. In addition to open enrollment for the exchange, Madam Chair, there any other top priorities for the first 90 days for the candidate gets selected as your executive director?
I'm going to again open that up to our board for priorities of our first executive director for their first 90 days.
Madam Chair, Tiffany Davis, for the record, Scott Kipper, Commissioner Kipper has his hands up.
I don't know how you see that so fast, but thank you for your assistance.
Well, I know that we have worked very, very collaborative. And by the way, Dr. Jameson, I do want to highly compliment the existing staff at the exchange for the fine work they've done with our staff here in the preparing the transition for Friday Health Plans as that program goes into liquidation, and the subsequent open and special enrollment period that the exchange has been undertaking to assist those people. I just want to say, at least from the Division of Insurance perspective, that would be a very significant focus within the first 90 days to make sure that those consumers are addressed and get the coverage that they deserve.
Thank you. Yeah, that's a big development, and it looks like it's proceeding as from an outsider's perspective in a very constructive way to take care of those members.
And again, focusing as the year continues to roll and more people are rolling off of the Medicaid, that continues to go smoothly. As Scott said, the staff has done an amazing job. From every aspect, from PR, the social media, the making sure our Get Insured vendors, everybody is collaborating to make that as smooth a transition as possible. And they've done a phenomenal job, and keeping an eye on that it continues, that we can help as many people as possible. As you were saying earlier, make it as smooth a transition, make sure that anyone who really needs, who rolls off and needs us, that we are there for them. And no matter, as you said, wherever they are and whatever obstacles they may face, that we can, the executive director will make sure we make it as readily accessible as possible. Is there any other comments from the board for our executive director? I would say that the first 90 days, which you hit on, that I was excited about, was just the fact that you want to spend that time getting to know all the players and cultivating relationships with them and listening to them very much. And that was the key thing I would expect our executive director to do in, as you said, a most transparent and humble fashion. That's the most important thing as a team leader, servant leader. And I think that's the most important thing, because we have an amazing team and they need servant leader type. Of course, that's my opinion, which I'm not sharing actually. Sorry, go ahead. Any other comments? I don't see any other hands up. And probably we've just about come to the end of our time. Tiffany? Do
Yes,
we
Dr.
have any other time for a final question?
We do have time for final questions. Dr. Jameson, Tiffany Davis for the record. If anybody has any other questions, comments, again, that want to be made regarding any statements that he's made during his interview or in regards to the resume information. And I would like to take a moment to, I know, and I hope this is okay, Quincy Branch, don't mean to put you on the spot. I know you haven't been asking any of these official questions, but if you do have any questions, Mr. Branch, please do feel free to raise your hand and to speak up.
Oh, and thank you, Tiffany, for that, but no, I'm fine, thank you.
Thank you.
But then I thank you very much for the interview. Is he still with us?
Yes, I am.
Oh, okay, very good. It has been an absolute pleasure. And I think you're probably already familiar with the process, and that we will be taking a break, a lunch and bio break, and then doing one further interview, and then having an opportunity to discuss with all ex officio their invaluable input and our board members, and then doing a vote. And then we will be getting back to you before the end of the day.
Very good. Well, I'd like to thank all of you for advancing my candidacy and spending all this time with me. I think it's nothing short of a miracle that you're all able to get together. And certainly want to compliment Tiffany and Katie and the folks that work so well with me as a candidate. I'm assuming for all of them to pull it together and keep us informed as we're trying to come up with this date. So thank you very much for your consideration. I feel like I'd be a great strategic fit for where we can go and what we can do. And I want to thank the staff and each of you for your time and consideration today. Thank you.
Thank you.
Madam Chair, Tiffany Davis for the record. This time we'll go ahead and move Troy Johns. Caitlin, if you can go ahead and move him back in the waiting room. Okay. Madam Chair, looks like Troy Johns is officially back in the waiting room. So if the board would like to make a decision on break, lunch, how you would like to proceed at this point.
Initially, the plan is to go ahead now and take our lunch bio break here. And for 30 minutes optional, which would mean it's 12:26 and just approximately a few minutes before 1 o'clock to resume. And this is again optional. If anybody or everybody or most of people keeping our quorum would like to push through, that is always an option. And comments appreciated.
Madam Chair, Valerie Clark. I mean, I'm happy to do the half-hour break, but I would be fine with just a 15-minute break.
Do I hear anyone else who'd like to just cut that to a 15-minute break?
I think a shorter break would be okay.
Okay.
Could I ask a question, a variation on what you proposed, Dr. Jameson? Would it be possible to do a 15-minute break now and then have a 15-minute break after we've heard the last candidate to give us a chance to sort of pull our thoughts together across the candidates?
Anything is possible. So why don't we do the 15-minute break proposal for the board members first? And if that's a go versus the 30-minute, then we'll move on from there. And then when we're done with the other candidate, we could discuss that step forward, the next step forwards. Okay. So anyone opposed to 15 versus 30?
Nope.
Okay, then I'll figure it's pretty unanimous that we'll be taking a 15-minute break and resume approximately 12:45, 12. How's that? Okay, thank you, everybody. Enjoy your 15-minute break and we'll see you shortly. Thank you. Welcome back, everybody.
Dr. Jameson, Tiffany Davis for the record. I think we'll just give people a couple, like just a minute or two to find their way back to their computers, if that's okay.
Absolutely.
Thank you.
That was nice to get up and stretch. I hope everybody had a chance. I was agreeing with Valerie that I could push on. That's the nature of many of us, but it was nice to get out. And down here, we had a few raindrops. I think we may be having a summer monsoon coming up.
Tiffany Davis for the record. Board members, as you rejoin the meeting, if you're not already on camera, if you don't mind putting yourself on camera, just so I can just kind of for the records reflect who is back with us, so I can confirm that we do have a quorum that way. Thank you so much.
Thank you, Tiffany.
Okay, and Madam Chair, for the record, Tiffany Davis, and I would like to let the record reflect that I do see with us yourself, Dr. Jameson, I do see Valerie Clark, Ms. Lewis, I do see Dr. Friedman, and Jonathan Johnson, and Quincy Branch, and then our ex officio, Stacy Weeks and Commissioner Kipper are all with us. So it looks like we have our full board who's with us today back on and joining our meeting. So I think we can continue on.
Florence Jameson for the record, and thank you again, everybody. I know this is, you guys are going above and beyond, as we say, doing the second mile today. And I really appreciate it as we're getting so close to finally getting a new CEO for the exchange. So let's go ahead and jump right in with our third candidate, Russell Cook. And will you want to invite them into our room?
Caitlin Blagan for the record. Russell Cook has entered the room. Hi, Russell.
Hi, good afternoon. Can you hear me okay?
Yes, excellent. Greetings and welcome. I'm not sure if you're able to see that most of our board members are with us and some of the staff, if you can see who is here today, but we are most appreciative of you being here today. And thank you for applying for this and look forward to this interview. We've got a process set out. They may have shared with you. Several of our ex officio board members, as well as our other board members, all of them invaluable in giving us feedback on these interviews today, and their wisdom. We much appreciate their attendance today. It's been a long morning and going into an afternoon now. And you are the third by reverse alphabetical. And we will be giving you 45 minutes for the first 12 questions. And they will be some asked by our ex officio members and our board members. And we're going to start with Dr. Friedman.
Hi, good afternoon.
Good afternoon.
The first question is, what are 2 or 3 professional principles that would guide your conduct as an executive director?
So I would say I've been a student of ethics since college. This is a topic that's near and dear to my heart. I would put at the top of the list, if you don't mind me grouping a couple together into one heading, honesty, integrity, transparency, I think are absolutely key. I think that proactive disclosure of exchange operations, exchange business, to the extent that we're permitted to do so, is absolutely fundamental to the success of this agency. That includes our relationship, of course, with our board of directors. And I believe firmly that no important decisions should be made behind closed doors. I believe that transparency for the agency on every level is absolutely fundamental. I also believe firmly in competent subject matter expertise. I believe that if we're going to speak authoritatively about a given topic, we ought to know what we're talking about. And that's something that I take very seriously, both on a policy level as well as on a technological level as it relates to the functionality of our exchange platform. That's an area that has been kind of the focus of my responsibilities at the exchange for many years, but I believe that's equally true in a policy light as well. Objectivity and impartiality, I think, are very critical as well. Open-mindedness, a willingness to change. Many of our staff members might tell you that I can be kind of stubborn at times, but I'm also open-minded, and I am always willing to hear out a competing idea, and I often change courses and flip-flop, so to speak. I wanted to mention also advocacy. Advocacy, I think, is really important as a guiding principle, not only in terms of advocacy of less popular or maybe poorly understood ideas to promote a balanced perspective within the agency, but also advocacy on a personnel level as it might relate to mediation in personnel matters. So I'll try and keep it as brief as I can. I'm a talker, so I hope that answers the question, but if you have any follow-ups, please let me know. Happy to go into more detail.
Sure, the second question is related. So I'm going to break it up into two parts. First, if you could please describe your leadership style.
I'm going to answer this in two parts. Historically, I have believed in leading from the front, leading by doing, leading by example. I've been directly involved over the years with establishing roles and responsibilities for the various teams within our organization. And I believe that my leadership style, even though I've been working as ISO and information systems manager, I do consider myself an important part of the exchange's leadership. And I believe that I've contributed to the can-do organizational culture that the exchange has followed for many years. And I believe that I have helped to set the tone for SSX to become as successful as we have. I think we're a leading state-based exchange, but we have a fraction of the staff of any other state-based exchange in the country. And I believe that at least part of that is attributable to that can-do attitude and the spirit of what I've tried to bring to the team following our transition. I recently spoke. I had a great opportunity over the last 2 months or so to speak with a number of our team members, and I got some constructive feedback and some constructive criticism about some changes that I can make going forward were I to be offered the position of executive director. I just want to briefly summarize those right now. Delegation is something that I heard from almost everyone that I spoke to. I have had a tendency over the years to jump in and take it upon myself to take responsibility for certain tasks that might not have been the best fit for an IT person, for an ISO, and I've kind of accumulated more and more of those responsibilities over the years to the point now where I'm doing an awful lot of stuff many days. Most of what I do probably shouldn't be assigned to an ISO, probably ought to reside elsewhere within the agency. So that would be, one of my key goals would be to delegate and also to provide training for staff members. Delegation, of course, you can't just hand over something to someone without explaining how to do it, and that takes time. And I've had difficulty in my current role finding the time to do that. And I'm really hopeful that if given the opportunity to serve as executive director, that I will have a little bit more bandwidth to pass some of these duties around to the appropriate teams within our agency, as well as to provide the appropriate level of training necessary to carry out those duties. Along with that, I believe that setting clear expectations is an important part of that delegation process. And of course, empowering other individuals really requires that we give individuals the opportunity to learn the way that I learned most of what I know in my current position, which is to learn by doing and often to learn by mistakes. So I think creating that safe environment to learn from mistakes is really critical as far as leadership style is concerned. Again, hope that answers the question. Happy to go into more detail if you'd like.
Terrific. And I'll just give you the second part of that question. If you could provide specific examples of how you can envision your leadership style being effective in three things: changing organizational culture, building successful teams, and resolving serious or longstanding conflicts.
Sure. As it relates to those first two goals, team building and organizational culture, I think I might have spoken to that a bit. I don't want to repeat myself, but I do feel strongly that finding the right fit in terms of duties, scope of responsibility for each team is a critical part of building successful teams, and also, receiving and responding to feedback from those teams, making adjustments where necessary, delegating decision-making authority to team leads. Every one of our teams has just a fantastic team lead, and it would really be an honor to work closely with them and hopefully to hand off what again has become an outsized share of decision-making responsibilities that I've carried for many years. I would love to pass some of that around the office and give these individuals the opportunity to contribute to that decision-making process as well. As far as organizational culture is concerned, I think that everything I mentioned so far is part of organizational culture, but I believe that the professional principles that I spoke to a minute ago will play a central role in the future of SS6's organizational culture. I don't believe that we are in need of any fundamental changes to our organizational culture, but it would certainly be a goal of mine to reinforce the transparency, the willingness to share ideas, even amidst the potential for criticism. I believe that these are critical aspects of our organizational culture that I want to help carry forward in the future. As far as resolving conflicts is concerned, that one's a little bit trickier, and the first place my mind goes is I want to kind of share a little bit about a recent example that Janelle and I had to deal with. It was an extraordinarily difficult personnel conflict, and I think in terms of personnel conflict, again, I'm gonna refer back to some of the ethical principles that I spoke about for the previous question. But I do believe that integrity and impartiality, as well as compassion and empathy, are central to effective mediation when it comes to resolving personnel conflicts. The conflict that I alluded to a moment ago, I know this is a public meeting, so I'm going to be careful not to mention too many of the specifics, but this was an issue that was serious enough and involved enough of our staff members that we actually sought assistance from outside of the agency. Madam Chair, this is something that Janelle and I referred to you as well. We had to ultimately seek assistance from our state human resources division. The HR, they got involved to mediate. And the resolution was positive. It was as positive as we could have hoped for given the circumstances, but it did require balanced stewardship and advocacy of our staff members while maintaining impartiality. So I hate to keep referring back again and again to the principles that I mentioned previously, but I believe those are absolutely integral to the process of resolving personnel conflicts and mediating as required in those types of situations.
Thank you for those answers.
Thank you, Dr. Friedman. Thank you very much. And the next person to ask questions is our ex officio, Stacy Weeks with Nevada Medicaid, who brings an amazing fund of knowledge of our Medicaid in Nevada, helping our board tremendously with her knowledge. And so those questions may be related.
Yeah, I'm just sorry. I have had something happen to my Word document. So just give me 1 second. Let me pull it back up.
No problem.
Never a dull moment with technology. Let me pull that up. Okay, my apologies. Okay, so this job, as you know, involves immense pressure from stakeholders, which includes insurance agents, brokers, carriers, lawmakers, consumers, small businesses, just to name a few. How would you balance these competing forces and stakeholders in your role as executive director?
This is something that I've fortunately and unfortunately had a lot of experience with over the last 7 years. What's the saying? A good compromise is when nobody is happy. I think we usually manage to do better than that, though. At a high level, there are guidelines, both state and federal, that kind of set some guardrails and in part at least can dictate the outcomes for most scenarios. But where there's room for interpretation, it's my belief that the exchange ought to err slightly, not heavily, but slightly on the side of consumer advocacy. I believe that the ACA is fundamentally about consumer advocacy. Although importantly, it was never intended and in practice is not punitive to insurance carriers. So I think it's really critical to maintain that balance there. Obviously, there are many other stakeholders that can be involved in these processes. The reason that I mentioned those two in particular is because we actually are going through a process right now that involves what appeared at first to be potentially competing interests between insurance carriers and tribal health clinics. You're going to hear a little bit more about this when the interviews are complete. I've had the great fortune in recent months to work in collaboration with our staff on a project to aggregate the premium payments for tribal health clinics for their members. Tribal health clinics are granted authority to serve as third-party payers for their tribal enrollees. And up until now, these enrollments have been administered on an individual basis. These tribal clinics have been paying individual premium payments for each of their enrolled members, on behalf of those consumers to insurance carriers. And an interesting thing to me when we started working on this process is that, at first it seemed like this would be something that carriers might be opposed to because it does require them to do extra work each month. But the more we talked to them, the more we realized that through this process of communication, through this process of stakeholder consultation, we kind of discovered that their interests weren't actually competing. Many of these carriers were, in fact, in favor of this process because the individual administration of these third-party payer policies was problematic. The enrolled population was transient. When we looked at the numbers, many of these policies were being terminated for non-payment, and then because tribal enrollees are afforded the opportunity, they have essentially a perpetual special enrollment period. They can just come back a few months later and pick up where they left off with a gap in coverage. That's not a great situation for anyone. It's not doing any favors to the consumers. It's leaving them with gaps in their coverage. It's substantially complicating the administration of these policies for insurance carriers. And tribal health clinics are obviously bearing some of that burden as well, some of that complexity. So we found that many insurance carriers were in favor of aggregated billing because it would likely stabilize these enrollments and turn them from some of the most transient enrollments that they're currently servicing into some of the most stable enrollments, and they're going to get a timely payment covering all these enrollments every single month, and hopefully we can engineer terminations for non-payment out of the process and make that largely a thing of the past. Another thing we learned along the way is that our insurance carriers were reporting problems with claims processing from claims that were submitted by tribal clinics. And this complaint was echoed by the tribes themselves, not only for primary care claims that were submitted by the tribal clinics, but also for specialist referrals where the referrals were conducted by the clinics as well. So we learned through talking to these stakeholders that, hey, maybe there's more to this aggregated billing process. Maybe there are additional opportunities here for the exchange to essentially facilitate these conversations and to broker some of these agreements between tribal clinics and insurance carriers. So while we initially set out to define a pretty narrow process to do with the aggregation of these tribal consumers' premiums, where we ended up is we realized that many of these tribal clinics do not have network provider agreements in place with their insurance carriers. And in at least some cases, that factor was contributing to the trouble with the claims processing. So taking a step back and looking at the big picture, we realized that we ought to be starting by brokering network provider agreements along with an addendum that guarantees federal rights for tribal enrollees for each one of these tribal clinics and their chosen insurance carriers. that would set the stage for a second addendum for clinics who wish to participate in this aggregated billing process to make that a codified, legitimate business agreement on an annual basis with these insurance carriers as well. So to summarize, we started out worried that we were going to be having to deal with competing interests. And through this process of communication, through this process of listening and information gathering, I believe we've come up with a proposal that will provide a win for both tribal clinics and insurance carriers. And I believe this is a model that we can apply to similar stakeholder relations in the future.
Great. All right. So this is one question, but it has two parts. So I'm going to start with the first one. What would you say the biggest challenges facing state-based exchanges in terms of achieving their goals and mission as outlined in the Affordable Care Act? Basically, what are the challenges right now really facing Nevada's exchange, given its goal and mission?
Right now, I believe that the answer is a topic that I'm sure is near and dear to your heart, which is the unwinding of the public health emergency and the obvious connection to the account transfer referral process that exists between the Medicaid and CHIP enrollment and eligibility system on one side and the exchange enrollment and eligibility system on the other side. And I believe that the future of decreasing Nevada's uninsured rate and increasing the accessibility to healthcare within Nevada is first and foremost about improving the account transfer process, improving the consumer education component of that process, and essentially streamlining the churn process for consumers whose income levels mean that they are often transitioning between exchange coverage and Medicaid coverage or vice versa. So I believe that is a largely technical challenge. And I believe that given my technical background, I believe that positions me very well to oversee what's going to be, it's probably going to be another year or two of steady, continuous technological improvements to that process, as well as improvements to messaging on both sides, as well as improvements to our applications, where I would really like to see us get within 18 months to maybe 2 years. Is something that has been piloted by a few state-based exchanges, and it's commonly referred to as auto eligibility. Right now, when the exchange receives an account transfer referral from a household that has either had their existing Medicaid or CHIP coverage terminated, which is what's happening in the PHE right now, or we also receive referrals for initial Medicaid or CHIP applicants who are denied eligibility and they're not enrolled in those plans in the first place. We're getting these referrals over to us, and we are able to ingest those payloads. We're able to create application records. We're able to send email notifications or print mail notifications to these consumers and let them know that they can come and use this claim code to pick up their application and take it and run with it. What we're not able to do, though, is to give them any idea of what kind of out-of-pocket costs they might actually qualify for, what kinds of APTC subsidies or cost-sharing reductions they might qualify for, because we need them to take that step of signing and submitting their application after verifying all of their application data. And we do the best we can. We pre-fill all that application, but they still have to take action. They still have to review that, and they have to submit the application before they can even find out whether or not they're going to be able to afford on-exchange coverage. And auto eligibility would potentially allow us, again, given some changes to the Medicaid application, and we would have to inherit some consent to verify income through the Federal Data Services Hub, the usual way that we do it. That's consent that we gather now on our application. But if we could inherit that consent, we could potentially verify the financial eligibility of households without them having to take action on our system. And when we send them the notification saying, hey, come over to the exchange and sign up, we can give them an actual dollar amount on that. We can say, here are the APTC subsidies that you would qualify for based upon the income that has recently been verified by the Division of Welfare and Supportive Services. And so in my estimation, I think that would be the single greatest improvement that we could make from the exchange perspective to Nevada's outlook at this point in time. So I hope that answers the question. Again, happy to go into more detail.
So you might have already answered this question. So how would you help address these challenges in Nevada, considering its unique coverage environment?
Are you asking specifically, how I would attempt to move us towards My
So the first
apologies.
question was, what challenges do you think Nevada's exchange faces? And it sounds like you're referring to an IT, right? That technical side of the coverage piece. So I think the question would be, how would you address it? You know, it's supposed to relate to that question from a
Sure.
policy.
I want to circle back on that in a moment because I fear that I might have given a bit too narrow of a perspective. That's one of many problems that I see facing Nevadans. I believe that reaching our underserved populations, some of whom might not be native English speakers, I believe that's absolutely a huge priority. I believe that there is great potential for us to reach some of those populations through targeted marketing. We've been making great strides over the last few months in terms of analyzing self-reported race and ethnicity data. This is something that we've never had access to until recently. We've had to work for a great deal of time with our vendor Get Insured to wrangle this data into a format that we can actually report on and translate into actionable intelligence. But Ms. Weeks, to circle back on my strategy for achieving the first goal that I outlined, I believe the stakeholder relationship with the Division of Welfare and Supportive Services, as well as the Division of Healthcare Financing and Policy, is integral to that process. As you may be aware, but other board members may not, we've been working for almost 2 years now in close collaboration with the Division of Welfare and Supportive Services, as well as—
I'm very well aware of that.
I remember you from some of those meetings. And my take is that the health of our relationship, our interagency relationship, is at an all-time high right now. We have implemented substantial technology changes over the last 9 months that have allowed us to dramatically improve the customer experience for these individuals that are transitioning off of Medicaid or CHIP coverage as a result of the public health emergency. We have been able to implement additional data fields in the account transfer payloads that allow us to verify loss of existing Medicaid or CHIP coverage and to automatically create a special enrollment period window for these consumers without any supporting documentation being required. We've also implemented more recently improvements to the payloads that allow our system to extract a much higher number of phone numbers than were previously available in these payloads. That has translated directly into an increased ability for the exchange's call center to perform direct-to-consumer outreach. So those are just two recent examples of successes in terms of these technological and procedural innovations that I'm speaking to. And I believe we've laid the groundwork. We have existing relationships in place. We have momentum going that can carry us through the next 1.5 or 2 years that's going to be required to get us where we need to be in terms of auto eligibility and in terms of improving just the overall comprehensibility of the churn process and the account transfer process. Again, I hope I answered the question. If I missed the mark, please let me know.
Nope, I think you answered it. Thank you.
My pleasure.
Madam Chair, Tiffany Davis here for the record. I just wanted to jump in because I don't want to cut off Jonathan Johnson with his question. So I just wanted to say that we have 7 minutes before the 30-minute mark. So we have roughly like 29 minutes left for the interview.
Excellent. So we are looking very good in our time. Jonathan Johnson, it will be giving our board member, Jonathan Johnson, will be giving our next question, 2 questions, 5 and 6.
Perfect. Great to see you, Russell. Thanks for joining us. As you know, the exchange is responsible to the state of Nevada for proper fiscal management. If you could take a moment and describe any legislative and fiscal experience you have, any experience working with budgets, budget planning, and specifically, please explain your familiarity with the state of Nevada's legislative process for submitting budgets.
Absolutely. So I've had a number of different positions in my career with the state. I believe I'm now in my 14th year with the state. And several of those previous positions have provided me with insight into various aspects of that process. There are a lot of budget building happens before these budgets actually get to the legislature, and the first portion of that process involves agencies, putting together what they call an agency request budget and submitting that to the governor's finance office for review. And I am very sorry. I'm going to get that out of the way. So that's something that I have some experience with in my work for the exchange. Not only was I involved with cost projections and revenue projections that led to our transition budget and putting that together, you know, in the first place in the agency request phase. But when it came back around to time to work that through the legislature, I was also involved with providing legislative testimony regarding the costs that would be required to transition the exchange off of healthcare.gov and establish our state-based exchange operations. And that was before we had an RFP. That was before we had a vendor. We just kind of had to do a finger in the wind estimate of how we could get there. And then, you know, try and convince the legislature that our numbers were valid and that we could back that part of the process up. And so that gave me a lot of experience, not only with the agency request portion of the budget process, but also with the legislative approval part of the process. Prior to working for the exchange, though, I worked as a business analyst in the governor's finance office, where I was involved with upgrades, enhancements, and user acceptance testing for the Nevada Executive Budget System, or NEBS. That's the software that's used to build budgets on a biannual basis. And so I provided technical support to the governor's finance office and the NEB system in particular for 2 legislative sessions before coming over to the exchange. So that's given me a pretty good level of familiarity, not only with the work that the agency does before we send it off to the governor's finance office, but also what happens to it, how those budgets are kind of weighed against other budgets from agencies, and how they get kind of whittled down to the point where the governor's recommended budget gets transmitted over to the legislature. So pretty familiar in terms of you know, practical experience with those portions of the process. Again, hope that answers the question. Happy to go into more detail.
Perfect. Thank you. Next question for me. What public speaking or media experience do you have, specifically responding to media inquiries or how have you handled potential negative or difficult questions from whether it's local, state, or national media?
Sure. So I'll state right up front that I don't have much direct experience with interviews by the news media, but I have a substantial amount of public speaking experience in terms of representing the exchange. Since back in 2018, on at least a monthly basis, and it was more like 2 or 3 times a month for the first couple of years, I have been facilitating monthly meetings for all of our insurance carriers, and those are held in a public forum. We usually have between 50 and 100 attendees, depending on the hot topics for the month. And not only do I facilitate those meetings, I also put together the presentations, and that often involves a lot of difficult questions. You're in the hot seat for 30, 45 minutes, sometimes an hour every month. And the questions are often very difficult. They are sometimes gotcha questions that really make me squirm a little bit. But my approach to these types of questions is first and foremost to share everything we can. Every bit of information that's relevant to the question, that is public information and that I'm allowed to share, is something that I'm going to share. And I endeavor at all times to answer every single question I can honestly and transparently. Now, there certainly do arise questions that I don't know the answer to. I will try to see if we have other staff members on the phone who can answer the question. Oftentimes we cannot. And so I always endeavor to provide a written response to the entire distribution list by the end of the day in the cases where I can't answer the questions. But importantly, I'm never afraid to admit what I don't know, because this is an extraordinarily complex program. I think all of us are learning new stuff every month and every week even. And so I don't have any qualms about acknowledging that I may not know the full answer or even a partial answer to these questions, that I have to go back and ask our subject matter experts, maybe do a little bit more homework rather, and get back to them. Now, you asked a few other questions, related questions about media inquiries. I wanted to mention also that we've received a number of entries. Something's in the water in recent months because we've been getting a lot of data requests, many of which have come from the media, many of which have come from public advocacy agencies, some of which have even come from insurance carriers. And I have been If you'll give me just a moment, I apologize. That's my my robotic assistant. I turned my glucose meter off, and so I'm just going to turn her back on for a moment. Sorry about that. My wife is very familiar with those alarm bells, by the way. So in terms of fulfilling these requests, much of that has landed on my desk. I've been working in close collaboration with our data analyst on staff, as well as Janelle, our executive director, to not only fulfill those requests, but we've also been working on what I think is a very interesting project, which is the standardization of a statewide enrollment report that we actually are planning on sharing on our website. Similar to the way that we provide biannual metrics once in January after open enrollment and once mid-year to CMS, I would like to see us moving in that direction of transparency and actually sharing these reports. These would be anonymized, no PII. We've been very careful to set up limits and guardrails on what information is contained. And I believe we have an approach that will protect the privacy of all of our enrollees, while also allowing for insurance carriers, public agencies, the media to have direct access to that data in a transparent manner and to be able to do the type of analysis that they haven't been able to do in the past because they haven't had access to that data. I did want to mention also that we've had this kind of universal standardized template ready for several weeks now, but we elected not to post it on our website pending a decision about the executive director. Should I not be offered the position, I wanted definitely the new executive director to be a part of that process and make that call as to whether or not that gets released. But it's ready and waiting, and I'm really excited about this because it certainly has simplified the process of fulfilling these data requests. We found that this standardized report is probably going to be serviceable in terms of fulfilling probably better than 3/4 of the data requests that we do get. So it's definitely making our lives a bit easier. But I spoke earlier about the principles of transparency and accountability. And I think we kind of just put it out there for everyone to see. We got to lay it bare. And I think that's an important part of the process. Last thing I wanted to mention is that I have consistently contributed to press releases. I don't know if that's exactly the type of media experience that you were inquiring about, but we've had press releases predating the transition all the way back to 2017, where we were announcing our intention for the transition or providing, updates, progress updates, updates about ARPA subsidies a couple of years ago, updates about preparations for the PHE unwinding. So I have maintained an active role in terms of contributing content to those press releases in written form, of course.
Perfect. Thank you so much.
Thank you, Jonathan.
Madam Chair, Tiffany Davis for the record. I'm so sorry to jump in. I just wanted to give an alert that we do have 20 minutes left for the last 6 questions.
20 minutes left.
Thank you.
So Valerie Clark will proceed now with 7 and 8.
Thank you, Madam Chair. Good to see you, Russell. We've touched on this a little already, but the question is, how would you rate the importance of transparency in the executive director role? And what methods would you use to promote transparency throughout the organization?
I don't believe there's any more important factor for an executive director other than being transparently accountable for the direction of the exchange. I mentioned, I think a great example, in the interest of time, I won't repeat myself too much, but I think that the initiative to provide a standardized report listing statewide enrollment data is exemplary of my commitment to transparency in general, and is certainly indicative of what my approach would be if offered the position as executive director. Internally, though, I believe transparency with our exchange staff is of equal importance in terms of staff morale and in terms of internal accountability. I encourage, even in my current position, I encourage our staff members to call me out when they don't think I've got something right, or even to call me out when they don't think that I'm facilitating a meeting in a fair and balanced manner, perhaps. So I think transparency cuts both ways, and I think it's critical that it does so. I try my best and certainly will make it a pillar of my position as executive director if I'm offered the job, to encourage our staff to share their feelings with me transparently, just as I believe it's important for the exchange to service the public in a transparent manner. And that extends, when I say the public, I mean public stakeholders as well, partner agencies, DWSS, DHCFP, Division of Insurance as well. I believe that transparency transparency, laying bare the exchange's records, our enrollment data, and sharing it as transparently as possible with any stakeholder that might be able to make use of that information is critical. And I believe that's going to be a cornerstone of the exchange's future success.
Thank you. Next question. Please describe your philosophy and approach when making big decisions that will affect your organization.
Well, my philosophy first and foremost is to bring everyone along for the ride. I mean, most stakeholders that I've mentioned in this meeting so far, I consider to be decision-making stakeholders. So in terms of decision-making, I think first and foremost, it's important to understand the scope of impact for a decision and to make sure that any stakeholders who are going to be impacted by this decision are involved in the decision-making process. Now, being involved in the decision-making process, sometimes the constraints of that decision can mean that that's simply that we keep stakeholders informed. But often, and certainly in my work, I endeavor to include stakeholders as consultants in the decision-making process. So I think identifying, the scope of impacted individuals, making sure that they're included in the process, making sure that we have a structure and a methodical approach to decision-making that allows for the contributions of these decision-making stakeholders, I think is of paramount importance. And I think we have some pretty good a pretty good track record, I should say, in that regard. So I'm not proposing by any stretch that I would implement any sort of radical new approach to decision making, but I think staying the course and trying to make incremental gains in terms of stakeholder inclusion in these decision making processes is going to be paramount for our future success.
Thank you so much. Appreciate it.
Thank you, Valerie. And moving right along with Scott Kipper of the Nevada Division of Insurance. Questions 9 and 10. Thank you.
Good afternoon, Mr. Cook. The exchange has implemented a new eligibility and enrollment system, and thus this position works very closely with the contracted technology vendor, Get Insured. How do you see your role in managing the exchange's vendors, and what would be your approach to problem escalation?
Thank you, Mr. Kipper. And I don't mean to be rude. It just occurred to me, though, that there's one thing I should have mentioned in response to the previous question. I'll keep it very brief, but I didn't want to leave it unsaid. There's no more important decision-making stakeholder in my mind than the board of directors. And because I'm speaking to you right now, it probably didn't occur to me to incorporate that into my response to the last question. But as I mentioned in my cover letter, it would be absolutely fundamental to me that the board be included in any important decision-making process. I think the recent public comment period for our tribal aggregating billing process is a really good case in point, and I think a really good success story as well of involving the board in that process. So didn't mean to get off topic, Mr. Kipper, sorry. Just wanted to make sure I didn't leave that unsaid. As it relates to vendor management, that has been one of my primary responsibilities for the last 5.5 years or so. I have a very constructive, I think the agency in general has a very healthy and constructive working relationship with Get Insured. I've had direct relationships since day one with their founders, as well as with their chief of staff. And I am ready, willing, and able to reach out and play those cards when necessary. Most of the time, we have a ticketing workflow that uses software called Jira, which is kind of a 4-letter word around the office, but it works pretty well. And as far as lower level concerns, functional problems with the exchange, data cleanup that may be required, bug reporting, certainly defect reporting is a big part of the process. We have a process in place that works pretty well, but certainly there arise from time to time scenarios or incidents which do require escalation. One recent example that comes to mind, this just happened a few months ago, relates to our change request for onboarding new issuers. I'm trying to keep it brief for time management, but for those unaware, the exchange every spring, we are faced with the prospect of new issuers that might potentially onboard and start doing business the following plan year. 2 years ago, we had 2 of those issuers. new issuers. Last year we had none, and this year we have 2 again. And because that is not a predictable part of our annual cycle, those costs have not been baked into our contract. And so those are supplementary costs that require a change request to be executed every time we want to bring new issuers on board. So a few months back, we got our change request for this year, and it reflected an 83% cost increase versus our the comparable change request from 2021. Same scope of work, same number of issuers, almost double the cost. So but after weighing the options for how we could approach this, I put together a relatively short, what I thought was a well-crafted email to their chief of operations. I pointed out that 2 years ago, Jennifer Krupp, whom you interviewed earlier, had negotiated a fixed rate per issuer so that we could build these costs into our budget. We have to budget in 2-year increments, but we never know how many issuers we're going to have on board. So it really helps to have a structured cost. All I really had to do was remind them of that structure cost that we had agreed upon previously, sent them some documentation, and an hour later we got an email response with a $66,000 discount. That's not the right word, price reduction, and we ended up paying the same price that Jennifer had negotiated back in 2021. So I think that's a good example of stepping in and kind of escalating these issues, and when things don't pass the smell test, providing a well-reasoned objection, and usually that does the trick. But for me, this also underscores the importance of having an insider in the director's chair. Having the continuity and having that background allowed me to, in a very short order, highlight what I thought was the kind of the crux of the issue, and put up an argument that I didn't feel like could really be dismissed, and it worked out okay. That's just one example, but I think that is exemplary of the way that I like to handle those kinds of situations. I've spoken thus far only about Get Insured. We do, of course, have other vendors. We have marketing vendors. We have the Abbey Agency. They do wonderful work, and they work closely with a subcontractor, Marketing for Change, who helps us a lot with data analysis, and is allowing us to move in more of a data-driven direction with our marketing and outreach efforts. I don't have as much direct experience with them, but we've had some very constructive meetings in recent weeks about future expectations and SX6's goals for those for the future of that relationship. Sorry. And there have been some difficult conversations in our most recent meeting with Marketing for Change. We had to raise some pretty vocal objections to a presentation that they had provided after having received the first round of race and ethnicity data. I mentioned a few minutes ago that we really only recently, within the last couple of months, have been able to wrangle that into a reportable format. And I have to say, a number of staff members at the Exchange had some very well-reasoned objections to the analysis that they had performed and to the conclusions that they drew, which attempted to correlate a number of socioeconomic factors to race and ethnicity that we not only thought missed the point, but that we thought really weren't appropriate for public consumption. And so we were able to articulate those, again, in a well-reasoned manner. I believe that, if you're going to object to something, you ought to have a constructive and positive alternative proposal, and you ought to bring evidence. And I think we did both of those things very well. And I think that bodes very well for the future of our relationship with Marketing for Change. If you'd like more detail, happy to provide it. But in the interest of time, I'm going to leave it there for now.
Thank you. What is your specific knowledge in the field of individual health insurance? And also, if you would, please also describe your working knowledge of insurance rating principles and processes.
Certainly. So some of my experience, and I don't know how relevant you're going to consider this, but I am a type 1 diabetic. You heard my alarm a couple times previously. And so I've had a lot of experience, too much experience over the years, navigating the waters of durable medical equipment and almost constant struggles getting prescriptions refilled, having claims sent to subrogation. So as far as consumer impact is concerned, I consider myself pretty well versed in the complexities of that system. But as far as the administrative component of individual insurance is concerned, most of my experience has been garnered over the last 7 years in my work for the Exchange. Now, as far as my working knowledge of insurance, I think you said insurance rating principles. I'm going to give you my folksy representation, and I hope you don't consider this to be offensively simplistic working for the DOI, but I would describe the job of an actuary as making sure that an insurance carrier brings in more money in premiums than they pay out in claims. Now, there's a lot more to it. It's extraordinarily complicated, the types of statistical analysis that are required to actually do that job well. But for the purposes of what the exchange is trying to accomplish, and for the types of work that we're trying to do in terms of consumer messaging and promoting awareness of exchange subsidies and the quality of exchange qualified health plans and the essential health benefits that they offer, I try not to get too mired in the details. But that is complicated, and the ACA makes it even a little bit more complicated by carving up states into rating areas. So actuaries are not only looking statewide at risk pools, they are also looking within certain rating areas, and that certainly changes the calculus. We have rating area 4 in Nevada as our rural counties, and the population of some of these counties is so small that some of these statistical methods of analysis that actuaries typically employ start to break down because the sample size is so small. So I think that's part of the reason why we've had trouble maintaining issuers in these counties. We actually had a so-called Bear County scare several years ago, and it's something that we monitor constantly to ensure that we're going to have options for people in these rural counties. Now, my 2 cents is that SS Hicks, the exchange, has some potential for contributing and possibly making the situation better. Certainly something that I would like the opportunity to explore as executive director. More specifically, I believe that sharing detailed enrollment data with insurance carriers as part of the initiative I alluded to earlier is going to allow them to do better actuarial analysis and perhaps conclude that, you know, maybe it's worth dipping their toes into that rural county rating area where they might not have done business previously. But provider networks are also a big problem in rural counties as well. We hear this from consumers, and the kind of the transient nature of provider networks in these rural counties is also part of the reason we've heard that insurance carriers might be hesitant to do business in these areas. So I believe that partnering with rural health clinics and support agencies, for instance, the Nevada State Office of Rural Health, I would love to have a conversation with them. Is there any data that we could share with you that would improve your processes? Is there any potential opportunity for, you know, a collaboration as far as messaging and outreach is concerned? The exchange has a marketing budget, and we have, you know, wonderful support staff and contractors in this area. Is there anything that we can do to help get the word out and improve this situation? Even so far as, you know, this is getting way outside of you know, the exchange's lane as far as statutory responsibilities are concerned, but can we perhaps partner with agencies like the Office of Rural Health to try and attract healthcare providers? There's grant money available for, you know, physicians who will go and work for a certain number of years in rural areas. Now, I don't mean to suggest by any stretch that they aren't doing everything they can do in that capacity, but if there's anything at all that the exchange can do to help, I want to know about it and I want to have those conversations.
Thank you.
Tiffany Davis, for the record, my apologies for interrupting. I just wanted to let everybody know we have approximately 4 minutes, or 5 minutes actually, my apologies, for the last 2 questions.
Well, I'll try and keep it brief.
You're on mute, Dr. Jameson.
Thank you, Levon Lewis, for 11 and 12 question. Go.
Good afternoon, Mr. Cook. If selected to serve as executive director for the exchange, what would you consider are critical leadership skills needed in order to manage and provide leadership for a diverse staff that serves a diverse community?
Certainly. So I'm going to sound like I'm repeating myself a bit, and that's true because I believe that the leadership principles or leadership style that I described earlier is going to be integral to those goals. In particular, I've accumulated a vast amount of program knowledge over the years, more than I wanted, frankly. But it's just kind of commensurate with the outside share of responsibilities that I've been, kind of gradually collecting and have been willing to continue. So I really believe that imparting some of this wisdom throughout our agency and helping to draft desk manuals, procedure manuals for our different teams, starting to write down some of this knowledge that's existed, only in here for several years is going to be a big part of that process, not only in terms of distributing and delegating the workload around the office, as I've mentioned several times, but also in terms of increasing the confidence level of our staff members to actually carry out these delegated duties. We're going to be, having to face the prospect of having our teams maybe do some things that they haven't done before and they don't have direct experience. And I believe from a leadership standpoint, helping to impart that knowledge, impart some of that wisdom, and also write it down for them and give them the opportunity to put that knowledge into practice, give them a safe space in which they can learn from their mistakes. I believe that's integral to the process. I want to pause for a second though. Am I missing the mark, or is that relevant to your question? I wasn't 100% sure how to interpret that.
Well, that's certainly answering part of the question, but it was to provide leadership for a diverse staff that serves a diverse community.
Certainly. So I would imagine you're asking in part about, commitments that the exchange can make to help increase staff diversity and perhaps the diversity of our enrolled population as well. Okay, wonderful. So I remember there was a similar question. I was sitting in my office last year when Ryan High interviewed for this position, and there was a similar question asked of him. And I kind of chuckled to myself and thought, man, I'm really glad I'm not in the hot seat right now, because that's a very difficult question to answer. There's really only so much that we can do to attract and retain diverse staff members. There are, of course, federal and state regulations that prohibit discrimination on the basis of race or ethnicity or cultural affiliation. Certainly, gender discrimination, sexual orientation. All of these things are big no-nos in terms of preferential treatment. So I will say at a high level that I believe that the best the exchange can do in terms of from a recruitment standpoint is if we are faced with a situation where we have two similarly qualified candidates, I believe it is in the agency's best interest and the best interest of the public in general for us to hire the candidate that will contribute to the diversity of the agency. Now, that may seem like a wishy-washy answer, but it's an issue that I thought, a lot about. And that answer comes admittedly amidst the backdrop of a statewide vacancy crisis for several years. The state of Nevada has so many vacancies, it's almost difficult to wrap your head around it, and filling those positions and retaining those staff members is a huge problem facing every state agency. Now, in terms of what we're doing to address the retention issue, I know that's a little bit different from the diversity question, but what we're doing to address the retention issue, this is something that Heather Korbielek pioneered several years ago, is trying to reorganize our org chart to allow for vertical growth within the agency. And I think there's one team that really stands out as an exemplar of that approach. That's our quality assurance team led by Shay Herbert. She has worked with previous directors to engineer the structure of that team to where it now has 4 tiers and allows for vertical growth within the agency. In fact, I supervise our data reconciliation team, and our data reconciliation team lead, Kayla, came from Shay's QA team. So we are doing our best to retain staff and to cross-train them and to provide them with progressive levels of responsibility in order to retain those staff members, make it compelling and exciting for them to stay with the exchange. But in terms of the actual recruitment portion of that process, getting those positions, getting new employees into the exchange in the first place, that continues to be a struggle. I do want to mention, though, from my perspective, that diversity in my mind refers not only to ethnic or racial or cultural diversity, gender or sexual orientation diversity, but it can also refer to ideology and socioeconomic or educational background, right? And so in addition to helping to promote cross-training and delegation throughout the exchange, I want to promote training and continuing education for new skills to ensure that we have the best equipped and most balanced staff possible on an ongoing basis. And that includes an increased awareness of the demographics of Nevada's underserved populations. Certainly just being aware of who these people are and where they are and what we're trying to do to reach these people. Promoting that awareness agency-wide, I believe, will have the effect of increasing the overall awareness and sensitivity to those underserved populations. That's going to help us achieve our goals in the future of actually reaching those populations and getting them enrolled in health insurance coverage. I believe also that from a training standpoint, I would very much like to see us implement formal training for writing style, for persuasive writing style. I would like to see us step up the quality of our writing throughout the office. I would like to see us implement a formal pipeline for copy editing, and I would like to promote the adoption of new technological skills. Microsoft Visio, for instance, a software that allows for flowcharts to be put together. I would love to see each of our team leads gain expertise and diversify their skill set in terms of having access to these tools that are going to make a meaningful difference for what they can bring to the operations of their teams. I hope that wasn't too all over the place, Ms. Lewis. I was trying to work some additional points in there about diversity, but in the interest of time, I'm going to leave it there. If you'd like additional details, I'd be more than happy to follow up.
Well, thank you very much. My camera has stopped working. So,
Ms. Lewis, before you
Yes.
continue, so my apologies, Tiffany Davis for the record. I just wanted to let us, the board know that we are over time on these questions. I know we need to finish out one more question before our last 3 questions. So just to keep with the fairness and consistency of the process for all candidates, whatever time is taken on this last question, we'll just subtract that from the 15 minutes for the last 3 questions. So just so everybody kind of knows how we're keeping this fair and consistent for everyone.
thank you. Can you share with us any initiatives you have directed to engage the diverse communities in Nevada?
Certainly. Again, at the risk of repeating myself, I'm going to fall back on what is an active going concern at this point in time, and that is our initiative for the aggregated billing for tribal health clinics and their enrolled consumers. That is something that began in earnest back in February. Our board, you all approved a streamlined process for the certification of what we're calling tribal exchange representatives, and that's going to allow employees, personnel of these tribal health clinics to utilize our exchange platform to provide enrollment assistance to their consumers in much the same manner as navigators, in-person assisters do, navigator grantees do throughout the rest of the state. And that was the beginning of the process. But since then, we have been working collaboratively with a number of different health clinics. We've been working very closely with the Reno Sparks Tribal Health Clinic. We've also been working very closely with the Fort McDermott Health Clinic. They've been helping us to pilot test this initiative in collaboration with Silver Summit, one of our insurance carriers. And so they have been really great stakeholders in terms of essentially serving as guinea pigs in this process, just kind of diving in with both feet, giving it a try, seeing what's working, seeing what's not working. And the exchange has endeavored as much as possible to incorporate that feedback into revisions to our process. And I believe that the proposal that is going to be up for review, I think later in this very meeting, represents the culmination of a wildly successful collaboration between the exchange, our tribal health clinics, and our insurance carriers. And I believe we have come up with a process that was far more robust, far more durable, and will be far more effective in the future than would have been possible had we not engaged those stakeholders early and often throughout this process. So again, I hope that answers the question. I know we're short on time, so let me pause there and see if any more detail might be desired.
Thank you.
I think we're probably good on that question. Thank you, Mr. Cook. And we're down to approximate probably 11 or 12 minutes to go through
10 minutes, Dr. Jameson.
10 minutes to go through our last 3 questions to round out our interview. So if you were selected as the executive director, when are you available to start working for this position in Carson City?
Now it's my turn to talk on mute. As soon as possible, I could literally start tomorrow. Now, I think our human resources division prefers us to change positions at the beginning of a pay period, but there would be, no delay, no fundamental reason why I could not start as soon as the paperwork could be processed.
Thank you. And do any board members have any questions regarding the information that the candidate has submitted in the resume or clarification requested on any of the answers already given? Tiffany, do you see any hands raised?
I have a question.
Madam Chair, go ahead, Valerie.
Okay, Valerie Clark for the record. I think this was a really good interview, Russell, and I'm impressed with the way you speak. One question I had is that your work experience has primarily been devoted to your IT work, which is very understandable. And it looks like you've got some great experience. My question is, have you ever considered taking any certification programs or anything in other types of learning, such as leadership or financial, more of a financial type of a certification, or things that would expand your resume, your knowledge base?
Thank you for that. I anticipated that this question might come up, and I am 100% prepared. In fact, I would be eager to take some additional certification. I'm thinking in particular, it had occurred to me that Nevada has a wonderful certified public manager curriculum. Janelle Davis, our operations manager, is just about to complete her journey through that curriculum. And if that is an important point to the board, that is absolutely something I would be willing to undertake, and I believe I could do so. I know that's a big time commitment, but I believe I could do so without undermining my ability to perform the rest of the executive director duties as required, with the caveat that Janelle Davis is about to begin maternity leave, and I would only ask that I be allowed to wait until she comes back from maternity leave, because whoever's in the executive director chair is going to be doing double duty for several months. And congratulations, Janelle.
Thank you.
Madam Chair, Tiffany Davis for the record. We do have two hands up, and I'll start with Commissioner Kipper.
Thank you.
Thank you, and Dr. Jameson, thank you for for being recognized. I want to circle back to the issues around the aggregated billing and the tribal clinics that you've been working with, as well as the work that includes those whom we regulate at the insurance carriers. It strikes me that this may be a bit of a compliance issue, perhaps, and I want to hear more about how the exchange in this issue collaborated with the DOI in making sure that all the I's were dotted, T's were crossed, and following through to make sure that as much as possible, it's compliant as possible.
That's a good question. And I'm going to admit up front, and I'm guessing you knew this headed into the question, we did not include the Division of Insurance as a decision-making stakeholder in that process. And in hindsight, I think there were some opportunities for improvement there. In our defense, I do want to mention specifically that the authority for tribal health clinics to serve as third-party payers on enrollments for tribal consumers is provided by the Affordable Care Act. And so it was our understanding, and certainly it was our approach to this process, that we were considering, what the exchange could do to design the best workflow possible within the parameters of those existing federal regulations that allowed for third-party payers. But I'm going to have to say that, I think you raised some very good points, and were I offered the position of executive director, I think that's something that we should discuss immediately, and I would love to lay out our proposal for you. Now, this proposal, of course, has been public for a couple of months now, or at least 5 weeks. I think it was made public on the 22nd of June. But again, but no backpedaling. I think you make some very good points, and I would love to discuss this issue further. I think that's definitely, I think you've definitely highlighted some room for improvement in our approach to the process there.
Thank you.
And Stacy, I believe you have your hand up.
Yes, thank you. So I just have two questions. One back to Commissioner Kipper's point. Medicaid also has an important role with the tribes, as you know, and when the state reaches out, we often do that in certain forums because tribes are off, different governments. And my experience, though, is when the state is working with the tribes, it's really important to sort of understand all the pieces because it does impact other areas. Because when the tribes come to the state, they often see the state. They don't necessarily know that you're not, when they think of health insurance, they don't sometimes understand the difference between you and Commissioner Kipper, and often where my team might be intersecting with them. So I just want to be mindful of that. In Medicaid, there's a federal law that says that we can't mandate that they enroll in health plans. And so my experience in trying to get them in a health plan has been very challenging. And so I think, there could have been some lessons learned from our experiences and some of my experiences in Minnesota as well. I'm just throwing that out there to Commissioner Kipper's point, is that when we're all working on this health insurance stuff together, I think it is important. And I know we're all busy and we often drop the ball too on our ends and not coordinating like we should. But I just throw that out there, especially with the tribes, because they are their own unique government, that when any of us act, doing them in the same, we have like tribal health director meetings that where often state officials get to interact. So just throw that out there. Maybe you use those forums and I wasn't aware of it. But I think to Commissioner Kipper's point, better coordination amongst all of us is important. But my question really is I too have worked in roles in Medicaid, like you've been at the IT level, right? So the details, the weeds, I've been in those kind of roles myself. And over time moved up into my role now as administrator. So I know what that's like coming from the weeds and the work. And I often still to this day want to do the work, and I have to pull myself out of that because I have to have a bigger picture thinking and I have to rely on my team to do the work. And to stay out of sort of the weeds and think about, besides this one issue that I want to fix, but like where are we going, right? And so my question really sits on the point of where do you want the exchange to go beyond like technology and that piece? What do you want to see and what would be your vision for the exchange over the next 2-3 years if you were executive director?
Sure. First, I want to acknowledge, yes, absolutely. You mentioned the directors' meetings for the tribes. We have been active participants in those meetings. In fact, we just participated in the last meeting the week before last. Where we provided a detailed presentation, kind of an overview of our proposal. And we tried as much as possible to bring that consortium along for the ride. Again, in our defense, I don't mean to be defensive, but we've been trying to move very fast on this issue, due in large part to the pressure, the intense interest, I should describe it as, that we've received from a number of different tribal health clinics who want a solution now, not yesterday. In fact, we received a great deal of pushback, not a great deal. We received selective pushback, even regarding the delay that the public comment period would introduce into the process, right? So I'm considering all those to be lessons learned. And, I think that what we got out of the last several months is, an ISO and an operations manager collaborating on a project that really would have benefited from the input of an executive director. And I guess the best I can do today is to assure everyone that my take as executive director would certainly be more inclusive, would be more conservative as far as, rushing forward and making decisions that might benefit from additional stakeholder consultation is concerned. So let me pivot back to your question, Ms. Weeks. So my goal for the exchange, I believe that we are a stable operation, and I believe that we have achieved some wonderful successes over the past several years. I am a big fan of the 80-20 principle, and I believe that we have achieved 80% of our gains, 80% of the potential successes that we could achieve with about 20% of the work output. And I think that it's time to roll up our sleeves now and do the rest of that 80% of the work to achieve those incremental, what I'm calling incremental gains. That would be the rest of the 20%, right? And so I do believe, I keep coming back to technology because I believe a lot of these gains are going to be dependent upon technology, whether it is by way of data analysis for our underserved populations, trying to figure out who are these people, where do they live, and what language do they speak, and how can we reach them, right? And that's going to require collaboration with DHCFP, DWSS, and DOI I would love to be a contributor for the exchange to be a contributor to the most accurate statewide map that's ever existed of Nevada's uninsured versus insured populations. I believe we have a lot of data that we can bring to the table. I believe Medicaid has a lot of data that they can bring to the table. And I believe the DOI has a wealth of data regarding off-exchange coverage that they can bring to the table as well. So I see a huge opportunity for synergy and for increased collaboration between those agencies in the future in terms of identifying these opportunities where the exchange can actually provide targeted outreach and can provide consumer education in the languages that these people understand, so that we can decrease anxiety about perhaps enrolling in a government program. That's a very real factor that we need to deal with over the next few years, and getting these folks comfortable with the notion of signing up in subsidized health plans. So that would be, my overarching goal. Certainly, I think, the obvious metric that anyone measures the state-based exchange by is, are you moving the needle in terms of decreasing the state's uninsured rate? But I believe there's more to it than that. I don't believe all uninsured citizens are created equal. And I believe that certain citizens have been marginalized for socioeconomic reasons. I believe there are certain citizens who might be immigrants, and who just might be unfamiliar and intimidated by some of these processes. And so I think that, again, reaching these people where they reside and figuring out what additional information we can provide, what assurance we can provide to increase their comfort level should be a cornerstone of the exchange's operations moving forward. And I certainly would consider tribal members and tribal health clinics, the populations that they serve, to be part of that conversation. And I believe that the success that we've achieved with this process, albeit lacking stakeholder involvement that might have been more desirable, to both of your points, I believe that's a template that we can apply.
I'm so sorry to interrupt you.
All right.
So we're at time. Yeah. And we do have one last question. So I'm going to turn it over actually to our HR representative for guidance on allowing the board to or to not ask this last question, since we are officially out of time in the insurance of fairness and consistency for all candidates involved.
Hi, good afternoon. Monique Williamson for the record. I was just going to say, if the chair did want to read the last question aloud, that would be fine. And then Mr. Cook, if you could just answer that in as few words as possible to keep us as close to the time as imaginable. Thank you.
Thank you, because actually I think the first half of the question is the important part for us. Lastly, do you have any questions or disclosures or anything you would like to discuss with the board so that it would assist us in our evaluation process?
So that would assist you in the evaluation process. I did have a question just regarding priorities at the board level. I'm not sure that would assist you in evaluating. I mean, that's more of a self-serving question, I guess. So if you're okay with it, Madam Chair, I think I would be most inclined to yield back the time, if that's all right. I certainly don't have any disclosures, though, or any reservations. I am committed to this agency, and I would truly, deeply appreciate the opportunity to serve the state and to serve the people in Nevada in this role.
Thank you, Mr. Cook, for the interview. And we will be getting back to all of our candidates, including yourself, in a very short period of time this afternoon. Thank you.
Thank you, everyone, for your time. It was my pleasure.
Madam Chair, Tiffany Davis for the record. Caitlin, if you could please go ahead and move. Perfect. She just did. Russell Cook is now back in the waiting room, Madam Chair.
So at this time, after our interviews now have been concluded, we wanted to give the board the opportunity to discuss the candidates and select the one that we would like to offer the position of the CEO of the exchange.
Madam Chair?
Yes.
My apologies for interrupting. I just wanted to address, I know Dr. Friedman had asked for a possible, after all three interviews were concluded, she had requested that maybe there be, I think, a 10-15 minute break just for her to for everybody maybe to wrap their heads around everything and then come back before they discuss. I just wanted to see if the board wanted to take that in consideration again before you move on.
Thank you for bringing us back to that. I would start with Dr. Friedman if she feels that is necessary at this point. Would you still like to go ahead and suggest that to the other board members?
It might be great to take like 5 minutes just so people, if people have urgent needs to get up, we don't, curtail our discussion.
Excellent. Do I hear, should we split the difference at 10 minutes or any other comments? 5 minutes?
I'm good either way.
So why don't we go ahead then and do just the 5 minutes and have a little bio break, and then we'll be able to really focus on our discussion of these excellent candidates. See you guys in 5.
Thank you.
At 2:10, we'll say.
Madam Chair, Tiffany Davis for the record, if we don't mind giving everybody just a few minutes to rejoin. And as they rejoin, I'd like to just once again have the board members come on camera if they're able to, just so I can allow the record to reflect who is back with us to make sure that we have a quorum.
Very good. Thank you.
Madam Chair, I think we're almost all here. I'd just like to confirm if Ms. Lewis, are you on and with us? Maybe if you don't mind, Madam Chair, if we just give her another minute.
Absolutely.
Thank you. Madam Chair, I think she's the last one that I'm waiting for. I do know that we received a message from Quincy Branch that due to an emergency, he had to drop, but we do still maintain a quorum, so.
Thank you. Did Lavon Lewis actually go off the Zoom call, or is she still on?
She was on. I'm wondering if she's having a little bit of trouble with her camera or sound. I think it looks like maybe she dropped. I'm scanning through our names right now to see if she did drop off and if she'll be rejoining us.
Did you send her a text?
I'm just about ready to do that, yes, for sure. Madam Chair, I just reached out to Ms. Lewis to see what her status is with rejoining.
Thank you. Maybe that's her.
Madam Chair, Tiffany Davis for the record. I just admitted Ms. Lewis back into the meeting. She's connecting right now.
Thank you so much.
My pleasure.
Welcome back, everybody.
Looks like she's connecting to her audio at the moment, so.
Okay.
Ms. Lewis, can you hear us?
Yes, I can hear you. I'm sorry. I cannot get my video to work, but I do have audio.
That's great. Thank you so much for confirming. Madam Chair.
Thank you for joining us. So now it's time for discussion and then selection of the executive director. In the past, our discussions were somewhat brief, and we can indeed have a discussion at until everyone has completed any questions, comments. And then the other option is, if everyone feels at this point with the resumes that we've all, bios that we have all reviewed, the reference letters, comments, public comments, and the very helpful interviews that we've just completed, if they feel at this time they are ready to vote, we can also go to vote. We did talk a little bit about with staff and DAG about how should we do the voting. And one thought was that we can ask everyone to vote for their candidate of choice. And if one of them gets a majority, then they would be the clear winner. If none of them do, the two with most votes would then have a runoff, somewhat like our primary and final elections. So if everyone would like to comment on those two issues, one, would they like to have further discussion, or are they ready to go to vote? And then finally, the nature of how the process of voting to be carried out. Any comments?
This is Jonathan Johnson. I would love to hear some thoughts specifically from Commissioner Kipper and Stacy Weeks as their non-voting members. Would love to hear their thoughts on the candidates before we go to vote. And if there's any other board members that have comments or thoughts that they'd like to share prior to that, I think that'd be really helpful for this group.
Stacy, would you like to share comments first, if you would feel comfortable and if you would like to?
I will go first and say I appreciate all three of the candidates. I think they're all three terrific choices. You know, we are big on collaboration here at the division. I think we work very well and very closely with a number of other agencies around the state, including the Silver State Exchange. Having said that, I was a little bit concerned about the last candidate talking about a very important issue, not only with us, but also with our state Medicaid office on collaboration on tribal billing aggregation with the tribes. I think is important, not only for the delivery of health service, but also, as Stacy pointed out, politically, it's a landmine that we can avoid if we work collaboratively on something like this. The other piece I would say is, in looking at all three, you know, we also cherish a great deal of experience here at the division, and I think that, you know, anytime we can find someone with a very broad depth of experience in a number of different settings and venues, we should question if that doesn't make some sense to investigate that piece a little bit further. So those are the two takeaways that I would submit to the board, at least for now, for my comments.
Thank you. Stacy, did you want to make some comments?
Sure. Thank you, Jonathan, for asking. So I would echo a lot of what Commissioner Kipper said. I think, you know, there's always a lot going on in state government. I know the exchange is not technically state government, but it plays such an important role. and affecting our agencies, and collaborating is really important. So whichever candidate you guys do choose, I think keeping that, like Commissioner Kipper put to the forefront, is very important, because the success, is going to really rely on those relationships and the ability for us to work together. And in the past, that is sort of, prior, executive director, Ryan always did reach out and give us a heads up on things. So I think, we're looking, at least from Medicaid's perspective, someone that does make that phone call and really work with us. I think all the candidates had strengths. I think each of them had, just like any interview, when you've ever done this before, you always have pros and cons on everyone. I think the one thing I really liked about Troy was just fresh air. Sometimes that's hard to get in Nevada, and sort of having a different perspective on this. I thought that was, I thought he was really well polished from that perspective. And I think this role is a lot of face time about what the exchange is. And I thought he held that role, could hold that role very well. I also thought Russ, definitely has pros. He has experience with the staff. He's been there. I think it is hard to come from a role where you're very much focused on the details and being a visionary, but I'm not saying that he couldn't. I just think that is one thing I would, if I was voting, that'd be one thing I would be thinking about, making sure that we have someone that can look ahead. Otherwise, you're going to constantly be looking from step to step and not thinking about the end. So I'm not saying that Russ couldn't. I'm just saying that's something I would be thinking about. So, but look forward to whoever you guys vote forward, and looking forward to working with them. So thank you.
Thank you.
Madam Chair, before you move forward with the board's discussion, just a reminder that you had asked for staff feedback as well, and Janelle Davis is with us to present that.
Yes, I was wondering when we were going to do that. And so I appreciate that so much. Is she ready to do that?
I am here and ready if you guys are.
Thank you so much, Janelle. We are very excited to have the staff input. In the past, this was not part of our prior selection of the CEO candidates. And so we wanted to expand the input, and we're extremely excited since they've done so much of the early work in putting it out there, posting it, reviewing it, presenting it, and of course, most importantly, working with their CEO, that we have an opportunity for their valuable input as well. So thank you, Janelle, for organizing that for us.
Yeah, absolutely. And thank you for the opportunity for me to present this. And also, I know our staff really appreciated the opportunity to provide their feedback. It is something new that we haven't done in the past. And I also just want to precurse this with Tiffany and I have been very involved throughout this entire board meeting and process and organization and the candidates. So our feedback is not personally included in this. So I just, in case there was a conflict of interest or you guys were wondering about that, our feedback is not here. I'm just merely acting as a spokesperson for the agency and kind of giving a high-level overview of their thoughts. And not everybody came to me either. You did hear from 2 of our staff members during public comment, so they also are not included in this section. So currently, the Silver State Health Insurance Exchange employs 22 full-time staff with a full potential capacity of 26 employees. So out of the 22 full-time employees, I received feedback from 7 of them based on the candidates who were interviewed today. So 6 out of the 22 employees expressed that they highly favored candidate Russell Cook due to his existing position within the agency. So extensive institutional knowledge of the agency and operations at the exchange, as well as feeling he's a confident decision maker for the agency. These 6 employees had no comment or were in neutral standing for candidate Troy Johns. There was a concern, if selected, that they were outside of the Carson City office. You know, how soon would they be able to come to Carson City, relocate, and start work? And then also just no institutional knowledge of the exchange. Also, 6 out of the 22 expressed that they were unfavorable for candidate Jennifer Krepp, again, due to being located out of the state of Nevada, and then having worked closely with this individual at the exchange in prior years, the feedback that I received was unfavorable. I already mentioned the public comment. We did have 1 out of the 22 employees who did favor candidate Jennifer Krepp. And this employee was also neutral and has no comment on the other 2 candidates. So that's the staff feedback. Again, very high level, just to give you some, hopefully to help you inform your decision, I guess. I also just wanted to mention and provide a little bit of feedback if it's helpful. Hopefully it's relevant. And Russell kind of alluded to this a little bit. We've been working under a skeleton crew for quite some time. I would say even since I started here at the exchange. I mean, we didn't have very many employees. We grew to 26, but there's always been vacancies, and retention and recruitment's been an issue in the state for a really long time. We haven't been with an executive director for the past 3 months, and so we've been working very closely to make the decisions for the agency. And, you know, me being second in command, I will be working, you know, I will be taking direction from the executive director. And I am going on maternity leave starting in September. So this position is, the selection of the executive director is very critical at this time. We've been without a leader essentially for quite some time. And although the exchange is very used to working that way, you know, we need one. And especially in my absence, the executive director role will be taking on extra responsibilities while I'm gone for about 3 months. So a lot of that has to do with the inner workings of the agency and, you know, HR related things, stuff like that. So, and then, oh, also it will be open enrollment. So really crazy times. So I just wanted to note that feedback, and hopefully that's helpful for you as well. And then I just wanted to mention, I will be talking about the tribal aggregated billing, the public comment after, you know, the board votes for the position. And, you know, this is a huge project of ours, and with all due respect, the exchange has been working